Have all finalists joined? Team A, can you raise hands? Have all finalists joined? Team A, can you raise hands? Have all teams joined? Team A, can you raise your hands, please? Team B, if everyone from your team has joined, can you raise your hands, please? Team C, if everyone from your team has joined, can you please raise your hand? Okay. Team D, if everyone has joined from your team, can you please your hand? Okay. Team D,
Hi, this is from Team D. One of our member is still trying to join.
okay, if she's not able to join, you can talk to her through correspondence or whenever she joins the Gmeet link, that is okay.
Okay, fine.
Team E, Shraddha and Teesta, have you joined? Okay. So I request all finalist teams to switch on their cameras during the entire duration of the quiz. All finalist teams to switch on their cameras during the entire duration of the quiz, please. I only see two people have switched on their videos. We'll begin when everyone, all the finalist teams have switched on their videos. You can mute your audio, and then through phone you can talk to your teammates and discuss. That's okay. That is okay. If everyone switches on their video quickly, we can begin. I mean, it's a post lunch session, so I get everyone's not in their best shape to show their face, but let's try, guys. I only see some teams have switched on their video. Is there a connectivity issue for people? I assume everyone has Navaratri. So, like, we have to go quickly now. If we start early, we can start. It's really like an online class now. Please switch on your video, finalists.
Guys, please switch on the videos. We will start it soon.
All finalists are requested to switch on your camera. You have to start. It's getting late.
Was there any difficulty in switching on video? Is there any difficulty in switching on video? Please text your fellow teammates and tell them to switch on video so that we can begin quickly.
I think we can start now.
Yeah, but all finalists must switch on their videos. That's the only rule we have to. It's okay.
How many participants in total?
We have
11 of them have switched on.
11 of them have switched on.
Yeah.
Wait. Okay. I think we can.
Yeah, sure.
Okay. So, good evening, good afternoon, everyone. Thank you for joining for the finals of Spiratio, the respiratory quiz. And congratulations, first of all, for making to the finals. Some guidelines for everyone is that we are going to be having 6 rounds. Um, and we have 12 quiz masters and 5 teams competing. We have pounds for certain rounds that will be intermitted by the quiz masters in the beginning of the round. So when you are pouncing, you have to send your pounds answers in the respective WhatsApp groups that have been created for this purpose. That I hope everyone is added to, because morning everyone's added to, right? Just raise your hands after if you've been added to the groups. Okay. Right, so I assume everyone's been added to the groups. So first we'll be having our Cryptex round conducted by Vanshika and Nandakishore from pre-final year Madras Medical College. Over to you, Nandakishore. You can present.
So, a very good afternoon to the finalists, 5 finalists. Welcome to the first round of Spiratio. It's Cryptex. So, it's basically a puzzle round. It's going to be fun. So, I'm sharing my screen right now. I hope the first slide is visible.
Yes, it's visible. Yeah, we can
Okay.
go ahead.
So, getting into the rules first. Each team, there are 5 teams here. So, each team will have 5 direct questions, 1 question per team. First, I will show you a 4x4 matrix which will have 16 phrases. You have to make 4 sets of 4 interconnected phrases within 90 seconds of time. So, teams interested to answer, that's through pounds, should like through pounds or through direct. Anyway, you have to answer it only through the text, through the WhatsApp DMs. The format that I want is in this format where the phrase number should be mentioned, and you can send it as 4 separate text messages or within the brackets. Okay. The marking scheme is in this way that the direct team who answers 1 set will get 10, 2 sets 20, 3 sets 30, 4 sets 40. For teams who are pouncing this question, only when you answer 4 sets correctly, you will get a plus 20. If you answer a partial answer or if you answer the 4 sets to be wrong, then anyways it will end up in a minus 10. So direct teams have no negative marking. They need not worry about this. They can answer whatever set they get. Am I clear? So this is a sample that I wanted to show you. I will show you a 16 phrase set like this actually. And I need you to answer in this format finally. I just wanted the numbers in the text box. Any questions? If I'm good to go, please raise your hand or show some signs so that I am ready.
And even the direct teams have to message in the group.
Yeah. So, shall I start with team A? Team A, are you ready?
If you have any doubts, please ask
Excuse me.
beforehand. Yeah.
Okay.
Like
Please.
the question, if like team A, it's our question, we have to still send the answer in the group, or we have to say it out loud.
Okay. If it's a direct question or in whatever way, if you're pouncing, I just want it only in a message format. I don't want anyone to unmute their mics and tell it loud, actually. Is it clear right now? I guess it's sorted. Okay, so
Okay, so
team A.
team is select your hyperlink. Team A.
Team
your hyperlink.
Team A, please unmute and select your hyperlink.
Mr. Incredible.
Okay. So, team A, your time starts now.
Okay, I'm starting the timer.
So time's up. 90 seconds is done. Please post the answers. Just within 5 seconds. Direct team.
So I'll close it.
Yeah.
So
Wait.
as of now,
Don't show the answers. Wait.
uh, Team A has answered this one pounds actually 8, 11, 14. No, Team A has got it wrong. Sorry. Team D has given just 2 answers till now. Team E has actually answered wrong. They have just given me one clue. It's wrong. So Team A and Team E get it minus 10.
Team A is the direct team.
Sorry. Team A is wrong. Team E is getting minus 10. Team B has just given me 3 responses till now. And the one of them is actually. Oh, okay. It's correct. Okay. Team D gets it 20 actually. Team D gets it 20.
Excuse me, does the direct team have negative marking?
No. Sorry,
Direct team
actually,
does
I
not
read it
have
wrong.
any.
So how can we get minus 10 here?
No, you're not getting. You're
That's
not
my
getting.
bad actually. That's my mistake. Team A doesn't have any minus 10. Team E has a minus 10. Team D gets a 20.
આપણે આ જ લખ્યું છે બ્રો આ 13 ને અને excuse me.
Yes.
Okay.
Like we have sent the right answer key as well. Only like one is missing, and I think there is something wrong in the answer key.
Oh.
Can you check? Because the set of 15, the set of 9, and the set of 14 is correct.
Yeah, you're getting plus 30. Team A is getting 30. 3 answers are right.
Team C is getting a minus 10 actually. Because they have answered only one part of the set actually. Team A gets a plus 30. Team B hasn't answered. Team C gets a minus 10. Team D gets it plus 20. Team E has a minus 10. So I guess it's done. This question is done.
Can you repeat the marks of every team?
So the direct team, Team A gets 30. Nandakishore, tell the other team marks now. Nandakishore?
Team A gets a plus 30. Team C gets minus 10. Team D gets 20. E gets minus 10. B has 0. B is 0.
Yeah, now coming to the answers. So the first set is about thoracocentesis done for pleural effusion using Abraham's needle at the 7 posterior intercostal space. And the second set is about pulmonary embolism, which is due to hypercoagulable state, that's DVT. Westermarck sign is seen on the X-ray, that's in the PA view. The Fogarty's catheter is used for the embolectomy. Then the third set is about a triad of the Pancoast tumor, which includes shoulder and arm pain, atrophy of hand muscles, and Horner syndrome. And the fourth set is about triad of the congenital diaphragmatic hernia, which consists of respiratory distress, scaphoid abdomen, and pseudodextrocardia. So we're done with the team A. Now we'll go to team B. Hyperlink set.
So team B, choose your hyperlink.
Salt Bay.
So team B, your time starts now.
10 more seconds for pounds to close. And time's up.
So team A, I just want to clarify one thing. Like you have sent 2 photos. Okay, fine. So let's get into answers. Vanshika, you start explaining. I'll tell the scores later actually.
Okay, fine. So the first one is Babes Earns Bodies, which contains polymetaphosphates, which is seen in diphtheric bacilli, that's Klebs loelfers bacilli. Then Parkes William 8 strain is used for vaccine preparation. The second set is about the imaging, that's the investigation of choice for COVID-19, which is HRCT, on which reverse halo sign is observed. The CORAD score is based on CT findings. Third set is about pneumomediastinum due to esophageal rupture is characterized by a left-sided radiolucency named as Naegelius V sign. And last is about legionellosis, which causes Pontic fever. Coiling phagocytosis is seen with Legionella, and this is cultured on BCY agar.
So at the end of this round, this question, team A will get a plus 20, team B plus 10, team C gets a negative 10, team D gets minus 10. So this is clear.
Hello?
Yeah. Please.
Why team D is getting minus 10 as we have answered one set correctly?
It's your pounds actually. We actually mentioned that the pounds should be only done when you get 4 sets correct, then only you will get a plus 20. If you and give me a partial answer, or if you give any of the 4 sets wrong, you are going to get minus 10 eventually.
Okay.
So team C, please choose your hyperlink. AG sir, please. AG sir, please choose your hyperlink.
That dodge, that mean whatever.
Yeah, the dog.
Okay, sir. Yes, sir. Your time starts now.
Ten more seconds for pounds to close. Time's up.
So as of now, I haven't received any answer from the direct team or from the pouncers actually. So I'm waiting for 5 seconds since 2 teams were typing. So I am shifting to the answers. Vanshika, you start explaining the answers. I check them.
Yes. Okay. So ALTB is characterized by an inspiratory stridor. Barking cough and steeple sign are seen on the X-ray. And the second set is about phantom lung tumor. 1 minute. Okay. Phantom lung tumor is a loculated effusion seen in the horizontal fissure, seen in cases of congestive heart failure. Third one is about Klebsiella pneumonia, also known as the exudative pneumonia, is characterized by lower respiratory tract infection symptoms and bulging fissure sign is seen on the chest X-ray. Fourth set is about posterior mediastinal tumor. Most commonly, which is a neurogenic tumor, is a dumbbell shape and has an intraspinal spread. The investigation of choice for this tumor is CEMRI. Now,
Excuse me. Excuse me.
Yes.
Group doesn't have inspiratory stridor. It has mixed stridor. Inspiratory stridor is specific for epiglottitis and supraglottic lesions. In group, we have bronchial involvement as well.
Yeah, but still, like Strider is only ALTB, so we can leave it. It's fine.
But
Mixed
like
is
the
more
set
common.
wasn't
Mixed is the more
matching.
specific.
The set wasn't matching. We had only one remaining and it wasn't fitting anywhere. That's why we didn't pounce.
No, actually, here the inspirator slider is there. Okay, as you said, both slider can come, but in other set it won't fix. So it's obviously when you're considering slider, it can fit in first set.
But it's characteristically mixed stridor, not inspirator stridor. The epiglottitis is inspirator stridor. You can check any book.
Yeah, it is okay, but this won't fit in any other things also, right? In set 2, 3, 4, it won't fix.
Any other condition that is given in this in these columns, it won't stridor won't come. Like pneumonia doesn't have stridor. Tumors don't produce stridor.
So in case if we would have not matched that and if you have submitted, then you would have given -1, -10. If only one wasn't there. So how can you consider that?
Mixed slider, inspirator slider, it can be matched in first set, right? So when you're saying inspirator slider, I think first ALTB or marking of only will be coming in a set. If any other team has issue
In
with this and they
case
have not
of
submitted,
dispute,
let me know.
quizmaster decision is final, so it is.
Sir, have you marked all the other answers correctly? Have you matched all other answers correctly? Because exudative pneumonia, Klebsiella, bulging fissure sign and cough with expectoration is very highly characteristic. So if you have matched all other things correctly, then probably the quizmasters will be able to help you.
No, it's fine. This is Team A. We can move forward. Thank you so much.
Okay.
So okay, at the end of this round, only Team C gets a +10. That's it for this question actually. So Team D, you get to choose your hyperlink right now.
Hello from Team D. First row, last one. Dog.
That's already been taken. I mean, you meant the dog face, right? It's already taken.
Then below the dog.
Salt base already taken actually. The
Last
only thing that
second.
is left is that left column 2 and the middle bottom one.
Middle bottom one.
Okay, fine. So Team D, your time starts now.
Last 10 seconds. And time's up.
So I haven't received any responses till now. Team D, are you attempting it? So I guess Team D is not attempting it. So I'll So Team D, I'm closing it. I'm making it
Yes,
sure
we are
that
not attempting.
Okay, fine. So once you can please explain the answers, I'll check. There's nothing. No one responded to this actually.
Okay, we'll move to the answers. Change the slide. Yeah, the answers are beclomethasone and cyclosamide are soft steroids. They are the drug of choice for persistent bronchial asthma. The next is about montelukast, is a competitive LT inhibitor. It is the drug of choice for aspirin-induced asthma. Then Churg-Strauss syndrome and hepatotoxicity are its side effects. Then terbutaline is the only SABA given by subcutaneous dose. It is used for exercise-induced asthma. Then the last one is methylxanthines. At toxic doses inhibits A1 receptor. As a result, it causes cardiac arrhythmias and seizures.
So I'll get back to the hyperlink. Team E, you can choose your hyperlink.
The one remaining. Which one is remaining?
Actually, two are remaining. The left column, both are remaining.
Left column. Okay, the upper one.
Okay, fine. So Team E, your time starts now.
Last 10 seconds. Time's up.
So okay, I'll shift to the answer slide. Vanshika, you start explaining.
Just next slide. Yeah. So farmers' lungs caused by moldy hay. It is a type 3 hypersensitivity pneumonitis. The common organism being thermoactinomyces. The next one is about asbestosis. The hallmark being ferruginous bodies and pleural plaques. The complication of asbestosis is mesothelioma. The next one is popcorn lung, also known as bronchiolitis obliterans, which is caused due to diacetyl inhalation. Chest X-ray shows tree in bud pattern. And last one is about sarcoidosis, which is a non-caseating granulomatous disorder. The hallmark feature is Sherman bodies. Scadding staging is used for diagnosis using an X-ray.
I think that's the end of round 1.
Yeah, just wait. I'm just calculating the scores. So for this question, Team A will get 20, Team B gets 0, Team C gets 20, Team D gets a -10, Team E gets the +10. They got one correct set of phrases. So I guess it's fine.
So with this, we come to an end of Cryptex round. Thank you for participating in this.
Thank you for participating. I hope you enjoyed this.
What are the final scores?
Core Master, can we have the final scores? You can unmute and say.
Team A got +70, Team B got +10, Team C got +10, Team D and Team E got 0.
Everyone's okay with their scores?
And everyone, please rename your ideas, the team name with the team number A, B, C, D with your name. So many of you are having only your names. So I just need you to rename with your team numbers.
Excuse me. Hi. Hello. Am I audible? Hello.
Yeah, you're audible.
So actually, I can. I am not able to change. I tried multiple times to change. Please bear it with me.
Can you repeat it? You're not audible.
He's not able to change his name, so it's okay.
Which team?
Team A. Team A. Om Shah.
Okay.
We are actually facing the same issue. Team E. We are unable to change our name with the team
Okay,
number.
we have a pounds group anyways. If you
Okay,
are
then.
not answering the direct question, you can message us through pounds and we have saved your numbers, so we understand. I mean, if you're not able to change, it's okay. If you're able to change, please do. It's just for convenience. So next up, round 2, we have round 2 conducted by Vignesh Kasi and Aditya K. It's again a mixed bag, I think. Okay, I'll just let them present the thing.
Hello, am I audible?
Yes, sir.
Okay. So good afternoon, everyone, and I would like to congratulate everyone over here to be participating and coming to the finals of the grand finale of Spiratio quiz conducted as a part of Genesis 2024. And me and Vignesh Kasi will be conducting the second round of this grand quiz, and we'll be starting now.
Finals, please switch on your videos, everyone.
Aditya, present for me.
Just one second. Okay, is everyone able to see my screen? Hello?
Yes, it's visible.
Okay, so our round is called Messier. It means to mix and match. It comes from the Latin word. So this round comprises of okay, Vignesh Kasi will be explaining the rules of the round.
அதுக்கு ஃபுல் ஸ்க்ரீன்ல வச்சிடுறோம்.
ஃபுல் ஸ்க்ரீன்ல தானே இருக்கு.
சைடுல தெரியல. சரி, ஓகே.
Hello, I can't see the screen. I can't see your screen.
Wait, what? 1 second. Are you able to see my screen?
Not yet. I can only see your profile photo. That Nand Kishore with the headlight and
1 second.
your neck side.
Let me retry presenting it. Okay, is my screen visible now?
Yes.
Okay, cool. Okay, is my screen visible?
Yeah.
Yes.
Full screen? Yes, okay. So as I was saying, Vignesh Kasi will be explaining the rules of the round.
Yeah, good afternoon. We'll be conducting the second round, that is measure, which is a mix and match round. I'll be explaining the rules. Each hyperlink has 4 questions. The first question will be a one word. You have to answer within 30 seconds and it would fetch you 20 points. The second question is a single image identification question for which you will be given 30 seconds and if you answer it correctly, you'll be given 20 points. And the third question is a syndrome based, which I will not be reading. You have to read yourself. You will be given 90 seconds. And if you answer it correctly, 30 points would be given. If in case you answer within 30 seconds of displaying the question, you will be given 40 points. Fourth is a mathematical question, which is an integer-based question, where 2 questions will be displayed in the same slide, which you have to answer. You have to find the answer for both the questions. For example, let's say a first part of question has apple as the answer. Second part of the question has orange as the answer. Apple has 5 letters, orange has 5 letters. So there will be a mathematical form like 5 into 5. What is x into y? Which is 5 into 5 is 25. Sometimes it would be x plus y. 5 plus 5 is 10. Okay, there is no pounds. Only the direct team who chooses the hyperlink must answer. Others should not unmute your mic. Okay, the direct team should unmute your mic throughout the round. Understood?
And the quizmaster decision will always be final. Okay. So shall we proceed with the round?
Does anyone have any doubts?
Anyone has any doubts?
Yes. See, now if there is the first question, the one word, if I answer it correctly, then only I can proceed to next, or it is not like that?
No. It is not like that. If you don't answer, you won't get any points. You can go to the next question.
And
everyone can answer all the 4 questions. For the 4th question alone, you'll get minus 20 points. Whether you answer it wrongly or you don't choose to answer it, you will get minus 20. You have to answer it correctly.
We have to answer here itself, or we have to answer in the group?
No. You have to answer in the mic. There is no pounds at all. So only the direct team can answer.
Okay, but we 3 are at different places, so we can unmute currently, right? And we can only unmute whenever we want to speak.
You can connect yourself in the call, right? Like for
we have connected ourselves. What I am telling you is that we can discuss on the call. Till then, we have to keep the mic mute.
You can actually.
It's fine.
Okay. Yeah. Okay.
But you have to answer within the time limit. Okay. If it is 30 seconds, you have to answer.
Yes. Okay.
Fine.
Okay. So anyone has any other doubts? We can proceed, right?
Okay, we'll proceed.
Okay, we shall proceed.
Just a second. 30 seconds after reading the question, or 30 seconds?
No.
Once I switch the slide, the 30 seconds will start.
30 seconds will start.
Immediately when I go to that slide, the 30 seconds will start. Okay.
Fine.
Yeah. Okay,
I'll not be reading the questions. You have to read the question. Okay, understood, right? Yeah, we'll proceed.
Okay, let's go to the hyperlink, shall we? Okay, we have 6 hyperlinks, and this round starts with Team B. Because Team A started in round 1, so this round starts with Team B. Okay, so Team B, can you please come on? Can you please unmute your mics?
Team B.
Team B. Am I audible?
B for ball.
Yeah. Team B.
Yeah. B for ball.
Yes.
Okay, so it is your turn to choose your hyperlink. Which one should I choose?
Harrison.
Harrison. Okay. So, the moment I change the slide, the timer will start. Okay. So be ready.
Okay.
I'm going to the next slide. Time is up.
Time up.
Time up. Please tell your answer.
Unmute your mic.
Unmute your mic and please tell your answer.
Can you please unmute your
The
mic?
apneustic center intermedial parapetal.
I'm sorry, I'm not able to
And the
hear you.
pneumotoxic.
Can you repeat the answer?
There will not be any partial marks for your kind of information. You have to get both the fill-ins correct. Then only you will get marks.
Can you answer?
The apneustic center.
Okay, what's the second part?
What is the second part?
And the pneumotaxic center.
No.
Okay, that's not the right answer. You have to get both of them correct so as to get the marks. You have only partially answered it. So we'll go to the answer slide. This is the answer. Team B will not be getting any points for this question. So shall we please go to the next question? Okay, I'm going to the next question, which is going to be an image-based question. So I will want you to be interpreting this X-ray for me. The timer has started. The time's up.
Kindly answer.
Request the participant to answer this question.
Kindly unmute your mic.
Is it normal X-ray?
Come again.
Yeah.
What did she say?
You told it.
I can't hear you.
Because it is normal X-ray.
Okay, cool. Yes, that's the correct answer. It's a normal X-ray. There are no findings. There are no findings in that X-ray. And Team B gets 20 points for this question. And we shall go to the syndrome question. Again, we will not be reading the question for you. If you get the answer in the first 30 seconds, you get 40 points. Afterwards, we will get only 30 points. So I'm switching to the next slide. So the first 30 seconds is up. Now the last 60 seconds is ticking down. If you could see in the corner of your screen.
Prader-Willi.
I'm sorry, that's not the correct
That's
answer.
not the right answer.
We will be displaying the answers now. I'm going to the next slide. It is actually Rohat-Net syndrome.
It's rapid onset obesity with hypothalamic dysfunction, hyperventilation, and autonomic dysregulation, along with neuroendocrine tumor.
This is taken from Nelson.
Yeah. Next question.
Okay. Next question. It's going to be a mathematical question. The moment I switch the slide, the timer is going to start.
If we don't answer the numerical question, we'll
You
still
will
get
get minus 20. You will get minus 20 even if you choose not to answer. So you have to answer something. First say the integer and then you can say the answer which you found. Okay.
Yeah. So I'm going to be switching to the next slide now.
Slide.
You get 45 seconds for this card. So your last 5 seconds is ticking down. Okay, that's time up.
Can we have the answer?
Can we have an answer from Team B?
17. Oh, sorry.
Only one answer.
Only one.
6.
Okay, you go on. Tell us the answer.
What is the answer?
Miller.
No. What is the integer first?
I want you to tell the integer first, and then you tell me the answer.
5 minus 5.
Shall we go to the answers?
Go to now.
Yes, it's actually -5. The answer is correct. So Team B gets 30 points for answering the question correctly. So Team B in this round, they get 20 points for the single image identification, and they get 30 points for the mathematical question. So score masters, please keep track of the scores.
Team B gets 50 points in this round.
50 points in this round. So I'll be going back to the hyperlinks, and the next team that will be answering will be Team C. Team C, please unmute your mic. Robbins. Okay, I'm going for Robbins. Right? Okay, so the moment
to draw about knowledge. So we'll be starting with the first question.
The timer will start the moment I switch the slide.
This is the fungal. This is voriconazole. It's any azole. It is oxidative mycosis.
Sir,
Gastromycosis.
Time off. Can we have an answer? Final answer.
Azoles. Voriconazole.
Azole is correct, but we want a specific one.
We want only one specific. Okay, don't switch the slide.
Okay, I'm not switching.
Sir, can we have only one answer?
Sir, we want one specific azole, sir.
Invasive night is voriconazole, right? It's more effective.
We have taken this question from Nelson directly. So from Nelson point of view, the answer is itraconazole.
Sorry, sir. We cannot.
Sorry, sir. I can't give giving you marks for this. So shall we go to the next question, sir?
Next question.
Okay. So the next question is a one image diagnosis. one image identification. So identify this device or this apparatus. Malditov is a very it's like vague. I want it to be specific. Malditov easier சொல்லலாம், but I want this to be specific. Like RS related யோசிங்க அந்த மாதிரி. So time's up. Does Team C have an answer?
நீ ஒரு ஆன்சர் வச்சிருப்பேன்னு சொல்லு.
சரி சொல்றேன். Safety slide. Okay, here is the answer. It's a MG tuber. This is taken from Apurba. Next question is a syndrome question. Okay, the syndrome, it could be any systemic syndrome that involves the lung, thorax, or the diaphragm. So this is applicable to all the syndromes that are present in our presentation. Okay, I just want every team to note that down. So next question.
Alstrom syndrome.
So that's a perfect answer.
Super. It's the correct answer.
It's the correct answer. You got it within 30 seconds also. So you will be
giving 40 points.
You will be getting 40 points for this question, sir. The Team C gets 40 points. Score masters, please keep track of it. Safety slide. So next is the mathematical question. I'm switching the slide right now.
Yeah, ஒன்னு வந்து ஷவுமேன் இன்னொன்னு மேசன். Dave, X is Showman, Y is Mason.
Yes, sir.
Mason is
integer, sir.
Integer, sir.
இது SCHAUM. இது வந்து 9 1 2 3 4 5 6 7
So time is
9 into 6 is 54.
Super,
okay,
sir. Correct answer.
You got the correct answer, sir. 54. So Team C will also be getting 30 points for this.
So Team C will get total 70 points, 40 points for the diagnosing within 30 seconds, and for the fourth question they'll be receiving 30 points. In total 70 points. Score masters, kindly note down. Now we will be proceeding with...
Can you come again? Can you just come again? Team C evlo score பண்ணாங்க?
Team C total scored 70 points in this.
Okay. Fine.
We'll proceed with Team D.
Okay, I'm going back to the hyperlinks. So Robbins is done, Harrison is done. The other 4 are left.
We'll go for physiology.
Physiology, okay. We'll go for Guyton and Hall. So next slide will be a first question, and the timer will start the moment I change the slide. So here we go.
Reiger test, Reiger.
Yeah, absolutely. Your answer was spot on. Team D gets 20 points for this question. Please note that down. Hit the slide. So the next question will be an image-based question. Okay, your 30 seconds is up. Do you have an answer?
Primary spontaneous pneumothorax.
No, it's not the answer. I'll go to the answer slide. So this table is directly taken from Bailey, and this is the donor criteria for lung transplant. Okay, I'm going to the syndrome question. The timer will start the moment I change the slide. The 30 seconds for the bonus marks is over.
I don't know, remember the exact name, but it's like Jovi, Jeuy, something like that syndrome.
Okay, you're insanely close. I'll give you
have to
another
answer correctly. Only one answer.
I don't know
You're
exact
insanely,
spelling, but it starts with
you're
J
insanely
and
close, but I will give you another opportunity for you to change your answer because you're very close.
Juvie.
You're very close. You're very
We are
close.
very, very close, but we need the answer.
Yeah, we need the answer, but I can give you another chance.
Juice.
Are you sure? Is it juice?
Yes.
Are you 100% sure?
Yes.
Okay, so I'm switching the slide, and we'll see what the answer is. Very close. I can't give partials for this, but so I will not be able to give any marks for this question.
Okay. Proceed to the next slide.
We'll proceed to the mathematical question. Shall we? Okay. So you guys have another 15 more seconds. Another 5 seconds. And that's time's up. Does Team D have an answer? Can we have an answer?
Tifnopilla index. Why is?
What is the integer?
We want the integer first.
No. 16.
Yeah. Proceed to the slide.
Did you say
the correct answer?
That's the correct answer. 16 is the correct
So
answer.
you get plus 30.
30 for this question. Okay, so they have answered the first question.
First question and the last question.
The last question. So
Team D gets 50 points in total.
So Team D gets 50 points.
Team D gets 50 points for this.
So I want the score masters to note it down. So we'll go to the next team. I'll go to the hyperlinks.
Team E, kindly unmute your mic.
I'll go with microbiology.
Okay, so we'll go with Apurba. So we'll go to the first question.
It's a drug, dupilumab.
Yeah, is that your final answer?
Yeah.
Okay. The answer, I think it's not that. You will not be getting any points for that. So we'll go to the image-based question. I would like you to identify the slide. This is a lung slide, to be more precise.
Hemochromatosis?
Are you sure with your answer? I think that's not the right answer. We'll go to the next slide. This slide has been directly taken from Robbins. It's large cell carcinoma of lung. It's directly taken from Robbins. We shall go to the syndrome question. So here is a syndrome diagnosis. So the first 30 seconds are over. So you will not be getting any bonus points for answering in the next 6
Crozen syndrome?
Come again?
Crozen syndrome?
Wait, you'll be given only one chance to answer properly.
You'll be given only one chance to answer.
Please don't guess.
Yeah,
Yeah.
You're close. I can give you that. I'll give you one more chance to answer.
You still have time, so try to think and answer. But don't try to guess. We'll not consider it.
Okay, your 60 seconds are up. Do you have an answer? Does team he have an answer?
Epworth syndrome?
Come again?
Epworth syndrome?
Again, you're very close, but the answer is different. You should have seen the mutation. It's directly taken from Langman, the mutation. It's Pfeiffer syndrome. So, okay, I'm really switching to the next slide. That is the mathematical question. And yes.
Your time starts.
Your time starts. Time is up. Do you have an answer for this question?
Autolysine.
X plus Y. What is the answer?
We want the indicative first. You're taking time.
Yes.
Could you please make it fast?
16.
16 is
Uh,
Not the correct answer. It's actually 19 because it's thumbprint sign, thumbprint appearance on gram staining.
so you'll be getting minus 20.
You'll be
for
getting minus 20 for this question. So Team E hasn't answered any of the questions, and
So they get minus 20 in total.
In total,
Four masters, kindly note, Team E gets minus 20.
Okay, so we are only left with Team A, and we have two hyperlinks that are left. We have
Team A, kindly unmute your mic.
We have Bailey and we have Katsam, which.
So we would go with Bailey.
So your choice is Bailey. Okay, we'll go with Bailey. All right. So the moment I change the slide, your timer will start.
Hello?
Yeah.
Yeah,
Okay. You want to answer?
spherules and arthrospores.
Yeah, that's the correct answer. You get 20 points for this question. Correct. So we'll go to the image-based question, shall we? This is the lung. The time's up almost. Do you have an answer for this question?
Ranki's complex.
Ranki's complex is not the correct answer. It's actually tree bark appearance of histoplasma. As I mentioned, it was a gross specimen of the lung. It's a peculiar picture from Robbins. So next question will be a syndrome question. The first 30 seconds for answering is over. The next 60 seconds begin. Does E may have an answer to this question?
Heener syndrome.
Yeah, absolutely. You get 30 points for this question. It's cow's milk hypersensitivity. And for the last question of this round, which will be a mathematical question.
Yeah, proceed to the next.
We'll proceed.
Hello, it is -3. X minus y equals -3.
X is?
X
X
is?
and Y are?
Plain test and Wells criteria.
Yes, absolutely. Your answer was correct. X minus y is equal to -3. And
so you'll be getting in total 80 points in this round, for, which is 20 for the first question, 30 for the syndrome question, and 30 for the last question. Score master, kindly note team A gets 80 points in total. Okay.
And I think that
concludes our round. I'll say the scores of all the teams in this round. Team A gets 80 points. Team B gets 50 points. Team C gets 70 points. Team D gets 50 points. Team E gets -20 points.
I hope you enjoyed the round, and I wish you all the best for the subsequent rounds of this quiz.
Thank you.
Thank you so much.
That was the end of round 2. So can we have the final scores from the score master, please?
Kamal?
Yeah. Gokul, is he knowing the list of scores?
Can you hear me, everyone?
Yes, sir.
So the final scores after the end of 2 rounds is Team A has scored plus 150, Team B has scored 60, Team C has scored 80, Team D has scored 50, and Team E has scored -20. Is that fine for everyone?
That's fine. Okay, moving on, we have round 3 conducted by Somesh and Afak from pre-final year MMC.
Core team chat box में score போட்டு
There is no chat box in Gmeet, no?
Oh, good afternoon, everyone. I'm Somesh from pre-final MBBS, Das Medical College. So myself and Afaq will be conducting the third round. I'll be presenting my screen to everyone. Am I audible? Can you confirm?
Yes, you're audible.
Yeah. So this is my screen visible? The full
Yes.
screen?
Yes, it is visible.
Yeah. So first, I would like to welcome you all for the Grand Quiz Grand Finals of Spiratio and congratulate everyone on behalf of everyone for making it to the finals. So this is a mixed bag type of round, which I guess will be fun to answer. So let me go to the rules for you. So each team gets to choose one hyperlink. Each hyperlink contains 3 questions. The first question is a one-liner. The first questions have 2 subparts. There's no partial marking. Only if you answer both the questions right, you'll get 10 points. The time limit is 30 seconds. And then the second question is the connect question, where there's 4 pictures with which you'll have to guess the answer. So if you guess the answer with the first clue, you'll get 20 points. With 2 clues, 15, 3 clues, 10, and 4 clues, 5 points. The total time limit is 60 seconds, and there'll be 15 seconds for the clue. And negatives will be given every time you guess for the answer and get it wrong. For example, if you guess once in the first clue, you still can guess for the second clue if you get it wrong in the first clue, but you get negative as well. So the third question will be a case. The case is for 30 points and the time limit is 90 seconds for the direct team. So there is pounds only for the case question. Remember, only for the case question there is pounds, and it is for 60 seconds. Marks for the pounds will be plus 20 or minus 20. Apart from this, there are negative points for all direct questions as well, which is minus half points for the corresponding questions. Meaning, for the one-liner, you'll have plus 10, minus 5, and connect based on the points for that particular clue, there'll be negatives. And for case, for direct team, it is plus 30, minus 15, and for pounds, it is plus 20, minus 20. And apart from this, there are anagrams present in each set. So in answer slides of every question, there are few letters which are highlighted in bold and italics. So the teams are requested to note down the letters separately. And at the end of the case question, you'll get 10 seconds to jumble the words and find the answer and give me the answer. So the pounds and the anagram answer will be, suppose you should put the answers in the WhatsApp group within the given stipulated time. So the maximum points that can be scored is 190 points. So how this is first question is 10 points, second is 20 points, third is 30 points for direct, and there are 4 questions for which you can pound, so 80 points. An anagram, it is 10 points per set, so there are 5 anagrams in each set, so totally 50 points. And Quizmaster's decision is final. So if you have any doubts, please ask me. No doubts, shall I move?
Okay, so hope everyone is clear and
Excuse me.
So much one doubt.
So we have 4 questions in question 3. There are 4 sub questions, and for every question there is pound.
In one hyperlink, there are 3 questions and 1 anagram. The pounds is only for the case question, and anagram is open to all the teams.
So you told that there are 80 points for pounds and 50 for anagram. So how is that 80?
So there are 5 case and 5. There's only 5 hyperlinks and 5 case. One case will be your direct question, which will give you 30 points. The remaining 4 questions will be for pounds. So you get 20 if you get it right. So there's totally 80 points in case. In anagram, there's 1 in each. 5 anagrams in total, 50 points.
And where are you? The highlighted would be the answer or the question?
Yeah, in the answer slide. In the answer slide.
Okay. Fine.
Yeah, and
If the team doesn't answer,
will not tell you.
Sorry.
The anagram.
हाँ दीदी जो हमारे से पूछे टोटल एक में 3 क्वेश्चन है बराबर पाउंड्स खाली क्वेश्चन બીજા કેસના આન્સર માટે બરાબર હવે એ આપણને આવડી જાય પછી આપણે
muted, yeah.
Okay.
AG sir, do you have any questions?
So Miss கேக்குதா
கேக்குது சார் சொல்லுங்க.
For the second question, you said that progressive marks are going to decrease as we go to the next clue.
Yes, sir. Yes,
and
sir.
if we don't answer and if we want to go to the next one, will that be considered as wrong or?
No. You can choose to attend whichever clue you want. You know,
okay,
you choose any other clue. Only if you get it wrong, you'll get negative for the clue.
Sure. And
no negatives for pounds, right? No, sorry, no negative for anagram, right?
No, every question has negative. I put it in the last line. See, negative points for all direct questions, minus half points for the corresponding questions.
For anagram is
for anagram, yeah, no negative for anagram, no negative.
No negatives.
If you don't answer, you don't get negative.
Okay, and for pounds also, if we answer anagram wrong, it is not negative.
Anagram is open. It's not pounds. It's open to all teams.
Okay.
Yeah, no negatives on anagram. So I guess it's clear. Shall we start?
If we don't answer, we get still negative or we get 0 for that?
For which question, anagram?
Third question. Case.
For the case, no. If you don't answer, you don't get any points. Yeah.
Okay, so no negative, right?
No negative if you don't answer. If you answer it
If you
and get
answer
it
it,
wrong,
there
you
is
get
negative.
minus 15.
Minus 15, yeah.
Okay,
Minus
okay.
half of the points. Yeah. Is it clear? So I'll be going to the hyperlink. So team, we'll start with team C. Team C, please to share hyperlink.
Peaky Blinders.
Peaky Blinders. Okay.
So Afak, please run us through. So I'm going to the first question.
Okay, so
You have 30 seconds. Yeah, we will start the timer once he completes the question.
Yeah. I will be reading the question. A 3-month-old male infant presents with history of persistent cough, rapid breathing, and poor weight gain. The mother reported that the symptoms started around 6 weeks of age and progressively worsen. The infant has difficulty feeding, appears fatigued, and is unable or tolerate lying flat without experiencing shortness of breath. On examination, the infant is tachypneic. Auscultation reveals bilateral mild hypoxemia. On HRCT, there was diffuse ground glass change, interlobular septal thickening, and discrete centrilobular nodules. Further evaluation includes genetic testing reveals SFTPC gene deficiency. What is the probable diagnosis?
You have 30 seconds to answer.
Do you have a syndrome for this, or is it like SFTPC or surfactant protein C gene deficiency? Surfactant protein C deficiency.
Yes, sir.
Adnala it is causing ILD. Is there a name for that?
Yes, sir. Yes, sir.
Yes.
It's from Nelson. It's from Nelson.
We are not answering this now.
Okay, so shall I go to the answer slide?
You can go to the answer slide.
So it's chronic pneumonitis of infancy. So teams, please take note of the highlighted letters, which is C and O. As is the first one, I'm telling to take note of it. But from now on, I won't be telling it. So I'm moving on for the next question. So this is a connect question. It is a diagnosis. So for the first clue, 15 seconds. If you attempt it and get it wrong, you get minus 10 for this. But you can choose not to answer. Do you have an answer? Can you go to the next clue?
Next one,
Next clue.
You say.
Yes, ma'am. It is
Okay.
the right
Yeah.
answer.
You got it.
You'll get plus 15 points for this answer. Team, note it. You'll get plus 15.
Plus.
So note the letters. Moving on.
Hey, 1 minute, Radhe. But anagram, is it a condition or can you will you say what it is, or you should find out?
நீங்களே தான் சார் கண்டுபிடிக்கணும். It's a very small. It's a small word. It's a small word.
The anagram is a medical word, right?
Yeah, it's a medical.
Yeah, related to the respiratory system.
Respiratory system only. Yeah.
So I'll read the case. Please read the case. We'll start the timer. It'll be 90 seconds. Please read the case fast. Yeah.
A 5 days old baby boy.
And before one second.
Okay.
Before you start,
Okay.
this has pounds. So it's plus 20 minus 20. You have 60 seconds to answer it. We'll give you time after we complete the question. Also, that's not a problem.
Yeah.
But this is a pounds question. So all teams, please be ready.
Please make notes. Start. Okay. A 5 days old baby boy, full term, born to a 41-year-old mother with history of gestational diabetes mellitus and a past medical history of a newborn death at age of 10, was secondary to congenital heart disease. There was no history of consanguinity marriage. During current pregnancy, there was no antenatal follow-up as she showed up only at the time of delivery. The baby was born through spontaneous vaginal delivery with birth weight of 3.4 kg and Apgar scores of 3 and 5 minutes at 7 and 9 respectively. immediately started to develop cardiorespiratory distress in the form of tachycardia and chest retractions that necessitate in neonatal intensive care unit admission for further evaluation. The infant was treated initially with nasal oxygenation, IV fluids, and empirical parenteral antibiotics. He was intubated after the chest X-ray, which showed the possibility of right-sided CDH. CT angiography revealed Bogdalak's hernia containing liver and kidney with collapsed right lower lobe. The child was taken to surgery, which revealed hepatopulmonary effusion and multiple small cysts of size 2 to 5 millimeter and solid areas blending with normal lung on cut surface of the right lower lobe. Okay, Somesh. Yeah, the X-ray is shown. X-ray and the CT are shown below. So yeah, what is your
I'm
diagnosis?
starting the timer now.
Timer
Direct
starts.
Direct team, please don't answer now. You can answer after we close the pounds.
Can you go to the before one, the case instead of
Yeah. So pounds team, you have 30 more seconds. Please give one single answer. Ten more seconds for pounds to close. The pounds closed. Direct team, if you have an answer, you can give.
This is CPAM, congenital pulmonary airway malformation. But question if biopsy of pleuropulmonary blastoma was there, it is type 4. But based on this, we can take type 2 now mostly. Then a right sided CDH is there, hepatopulmonary effusion, type 2. But if it is like malignancy proven on pleuropulmonary blastoma, it is type 4.
Okay, sir. Okay, you got
the
right answer, sir. It is type 2 CPAM.
It's type 2 CPAM, yeah.
Yeah, okay.
So please note the anagram. I'm changing the slides. Now and team E has given the wrong answer. So they'll be getting minus 20. Please note it, team E is getting minus 20. So anagram, please. You have 10 seconds. Please text it, don't unmute and tell it. So time's up. I don't think anyone has given me the anagram. So I'll go to the anagram answer slide. It's Criolla bodies. So team C in this round has got plus 15 and case they have got plus 30.
Plus
45 points. Yeah. And for team E this round it is minus 20. Team C plus 45, team E minus 20. Please note
Please take note. Okay.
So team D, please give your hyperlink.
Team D.
Team D, are you there?
Hello.
Breaking Bad.
Okay, Breaking Bad.
Okay, so I'll move on to the first question. You have 30 seconds to answer the question. 45-year-old male presents with 6-month history of intermittent coughing, shortness of breath and chest tightness. He works in a flour mill and reports that his symptoms tend to worsen during his work shifts but improve on weekends. He denies smoking and prior history of respiratory illness. Examination bilateral fractals at lung base. Restrictive pattern was noted on PFT. Test X-ray shows diffuse interstitial infiltrates. No fever, weight loss, and night sweats. What is the diagnosis? Name the antigen. 30 seconds. If you answer only both the questions right, you'll get plus 10.
Yeah, there are no partial marks.
You have 10 more seconds. Do you have an answer? Time is up.
No answer.
Okay.
So this is an actually repeated question.
Yeah,
We're
it's
really
a
sorry
repeated
for
question.
that.
Okay.
Really sorry for that. The answer is Miller's lung and Cephalophilus granaries.
Granaries.
So do not forget the anagram. I'm moving on. This is a connect question. 15 seconds per clue. First clue.
Second clue.
Okay.
Do you have an answer? Can I go to the third clue? Moving on to the
third clue board.
You want the full organism name, genus and the species name.
Klebsiella?
Sorry?
Klebsiella?
Sorry, the answer is
No, the answer is
wrong. So you'll get negative for this, but you still can attempt after the fourth clue. You will be getting -5. You can still attempt now. You'll get one chance.
Streptococcus pneumoniae.
No, it's wrong. So you'll get -2.5 for this. So the answer is Haemophilus influenzae. The first photo is Pfeiffer. It's also called Pfeiffer's bacillus. It's pneumonia. It is epiglottitis, Thumperlin sign, and Quell-Lung reaction. Quell-Lung reaction for the capsule. So note down the anagram. We'll move on. You get -7.5 for the question. So a 16-year-old boy came to the OPD with shortness of breath during excursion for 1 month. He had incident onset dyspnea that was increasing. Dyspnea occurred during strenuous exercise, which restricted his activity and outdoor play. He had occasional cough without expectation. There was no fever, wheeze, hemoptysis, P&D, chest pain. General survey and systematic examination revealed no abnormalities. Routine blood and biochemistry were normal. Spirometry was within normal limits. Chest X-ray showed non-specific paracardic reticular nodal opacities. ECG was normal, no history suggesting of atopy. He had similar complaints is present in the elder brother. See, chest X-ray and CT thorax are shown. You have a this is 60 seconds time starts for the pounds.
Pounds, yeah.
Please don't direct him. Please don't answer now.
Can we go to question?
Pounds team, if you want to pounce, you have 30 seconds left. You get plus 20 points. Shall I show the image? Pounds team, 10 seconds. Pounds
Okay.
is close.
Time's up.
Pounds is close. Direct team, if you have an answer, please. Okay, moving on to the answer. It is pulmonary alveolar microlithiasis. Direct team, you don't get any points. Team C, you answer the pounds correctly, so you get plus 20.
Plus 20. Okay.
And anagram, you can start sending. You have 10 seconds. So Team D has given me the anagram CBA. Team E, if you have an anagram, please send it now, or we're moving with the answer. So it's Mason bodies. Team A, B, C, D have given the right answer. So team, at the end of this, just give me a second. So end of this round, Team A gets plus 10, Team B gets plus 10, Team C gets plus 10, Team C gets plus 30. I'm
Plus
sorry.
30.
Team C gets plus
Yeah.
30, and Team D gets plus 2.5.
Okay.
Scoring team, have you noted? Should I repeat again?
Scoring
Plus
team.
10 for Team A, plus 10 for Team B, plus 30 for Team C, plus 2.5 for Team D.
Okay, that's fine. Cool.
Okay.
Yeah. So Team E, do you have an hyperlink?
The Good Doctor.
Yeah.
Okay.
So Afak, please read the question.
Okay, so I am reading the question. A 60-year-old woman with history of chronic cough and recurrent respiratory infections present with worsening dyspnea and productive cough over the past month. Chest X-ray reveals a right upper lobe mass. Also, the patient was asked if she had the habit of voluntary suppression of cough, to which her response was affirmative. Bronchoscopy reveals an obstructive mass in the right main bronchus. What is the clinical condition and the organism implicated for the same?
Marks only
Yeah.
for both the questions.
You have to
Answer
say
correctly.
both there are no partial marks. You have to say the complete answer.
Okay, do you have an answer?
Yeah, due to tuberculosis, Mycobacterium tuberculosis, bronchogenic carcinoma.
Sorry, the answer
Sorry,
is
the
wrong.
answer is wrong.
This
It's
Lady
actually
Windermere
Lady
syndrome.
Windermere syndrome. And the organism
The
implicated
organism
is
is
MAC.
MAC. So I
Please
hope you
take
have
note
noted
of
the
letters.
moving on. So the connect question is a diagnosis. 15 seconds. Please ask for the next clue if you want.
Next clue. The next one. Pregnancy में कौन सा?
Do you need the final clue?
Yeah. Intubation कर रहे हैं उसको. Okay.
Do you have an answer?
Do you have an answer?
No.
Okay.
Okay. So the answer actually is Mendelssohn syndrome. It is a complication of anesthesia, more common in pregnant women. Chemical aspiration pneumonitis, and tracheal aspiration is the management. So note down the letters. Moving on. So this is the case question. Pounds. There's pounds for this, so all teams be ready. Afak.
Moving with the case question, a 55-year-old female former smoker with a 30-pack year history presented with a 2-month history of progressive dyspnea, persistent cough with occasional hemoptysis, severe chest pain, and unintentional weight loss of 6 kg. She also had symptoms of nausea, vomiting, muscle cramps, and increased thirst. She also complained of paresthesia and hyposthesia of limbs. The patient had quit smoking 5 years prior and denied any significant past medical history. Physical examination revealed decreased breath sounds on the right side, grade 4 clubbing, and enlarged supraclavicular lymph nodes. Chest X-ray and the CT is shown. Somesh, can you show the chest X-ray and CT? Yeah, so this is the CT and the chest X-ray, and what is the diagnosis?
Pounds team, you have 60 seconds. We want the specific answer.
Yeah, we want the specific answer. Yeah.
Can you guys go back to the case once?
So pounds team, last 10 seconds. It's a very simple, straightforward answer. I'm closing the pounds. Direct team, if you have
Direct
an
teams.
answer. Do you have an answer? Direct team?
No.
Okay.
Yeah, just give
Shift
me
to
a
the
second.
answer slide.
Going to the answer slide. It's bronchogenic carcinoma,
Small
small
cell
cell
variant.
variant. So the findings for this is mediastinal widening, central tumor in CECT. Then you have the neuroendocrine symptoms as well.
We have the symptoms of
Yeah.
SIAD, which is a paraneoplastic manifestation of small cell cancer.
So team D gets it wrong, so they get minus 20 in pounds. So at end of this round, team D alone gets minus 20. No other change.
No.
So anagram, if you have the anagram. So as no team has given the anagram, I would like to give a clue. It is a drug related to respiratory medicine. If we'll give another 10-15 seconds if someone can come up with the answer.
Okay, team C has given under.
So I'm closing the anagram question. So the answer is bosentan. So team A and team C will get plus 10.
Plus 10 marks.
So at end of this round, team plus 10, team C gets plus 10, and team D gets minus 20.
Hey, Somesh, one doubt.
சொல்லுங்க சார்.
இப்போ அந்த question bronchoalveolar carcinoma small cell variant, why was there hyperesthetic paresthesia seen in the patient?
சார் அந்த சியாட் manifestation கூட சேர்ந்து anti no, not CIAD. It is also nervous system manifestation, sir. Antibodies against அதனால cancer.
What paraneoplastic is that?
லெம்ஸ்ல paresthesia வருமாடா?
ஹைப்போனேட்ரிமியானால அதுக்காக எழுதி இருக்கிறது சார். அது பாராஸ்தீசியா.
சரி, ஓகே.
யூவாலிமிக் ஹைப்போனேட்ரிமியா, அதனால
paresthesia is due to hypocalcemia.
Why is that hypocalcemia as a paraneoplastic?
It secretes hypocalcemia.
See, hypocalcemia only will cause paresthesia, okay? And that too, you'll have hypercalcemia, not even small cell variant. You'll have it in squamous.
Squamous only will have hypercalcemia.
Squamous is hypercalcemia, small is hypocalcemia, and the presentation was of hypocalcemia.
Okay.
So what we don't have the correct references, but there paraneoplastic syndrome, both CNS manifestation and CIAD manifestation were given. So we chose to take both of them.
Yeah.
So we'll look into it. Yeah.
Okay.
So team A hyperlink.
Money heist.
We'll go to the first question. A 55-year-old woman with a history of bronchiectasis presents with worsening shortness of breath and occasional blood in sputum. Chest X-ray reveals a cavity lesion in the right middle lobe with dense round mass in it. CT confirms presence of fungal ball. What is the probable diagnosis and radiograph signs seen here? You have 30 seconds to answer.
So yeah, this is monod sign and this is aspergilloma, indicating monod sign.
Yeah, you're right.
So it's plus 10. Please note the highlighted words. Moving on. Identify the organism, both the genus and the species name. 15 seconds. You can ask for the next clue if you want. Going to the next clue.
Next.
Final clue. What do you want the last clue?
Next.
You have 10 seconds to answer.
Is this
So time is up. Do you have an answer?
agrobacterium?
No, sir. It's
No.
wrong. So you'll get minus 2.5 as you attempted wrong in the last clue. So the correct answer is Legionella pneumophila. So the connect pictures were Pittsburgh agent, coiling phagocytosis, type 4 secreting system, and buffer charcoal yeast extract. So all pointing out to Legionella pneumophila. So please note the anagram words. Moving on. So the case question open to all teams for pounds. So please note it down. A 32-year-old gentleman went to his office and at a time he was totally asymptomatic. He suddenly had a bout of cough and became unconscious. Colleagues hurriedly took him to a nearby hospital. He was in shock. His blood pressure was not recordable and pulses were feeble. Physical examination did not reveal any cardiovascular abnormality except peripheral circulatory failure, and his heart rate was 120 per minute. The CVG was 98. SpO2 was not recordable. Because this is treated with IV saline, noradrenaline, and hydrocortisone. ECG was normal. Bedside troponin test was negative. His conditions improved dramatically. He was almost normal after 4 hours, and he was investigated next day. His WBC shows 11,000 per millimeter cube. Neutrophils are 65, lymphocytes 28, eosinophils 5, monocyte 2, HB 14.5, ESR 36 in the first hour. His biochemistry were normal. Chest X-ray PA view showed a thin-walled empty cyst in the right cardiac angle. His CT and CT chest and brain MRI were normal. So I'm going to the image. So 60 seconds for the direct team. 60 seconds for the pounds. So direct team do not give the answer.
Previous slide, please.
Yeah. So pounds closed. Do you have direct team? Do you have an answer?
How much negative?
Minus 15. Plus 30 minus 15. 15 seconds.
Hello.
Time's up. Do you have an answer?
Yes, we have an answer.
Okay.
Yeah.
So this is basically a hydrated cyst which has been ruptured.
Yeah, that's actually
Yeah, you're
right. It's the
actually right.
ruptured
Yeah.
pulmonary hydrated cyst causing anaphylactic shock.
Yes. Okay.
So Team A will get plus 30 for the case question. Team C, unfortunately, that is the wrong answer, so you'll be getting minus 20. So have you noted the anagram word? Shall we move on? Yeah.
Okay.
So anagram, please. So anagram time ends. So we're going to the answer slide. It is sarcoid.
Team D.
Team C gets plus 10. Team D gets plus 10. Yeah.
Okay.
So at the end of this round, Team A is getting plus 47.5. Team C. Team C gets minus 10. Team D gets plus 10. So at the end of this round, Team A gets 47.5. Team C gets minus 10. Team D gets plus 10. So Team B, I think only Prison Break is left. Are you ready?
Yes.
Yeah. Third-year woman presents with recurrent episode of right side chest pain, shortness of breath occurring within 2 days of onset of a menstrual period over the past 6 months. Denies any history of trauma of underlying lung disease. The strictly given condition. What is the most likely diagnosis and what is the underlying mechanism? You have 30 seconds to answer. So no partial marks.
Catamenial pneumothorax.
Okay.
Okay.
Underlying mechanism.
Endometrial nest are present which bleeds during menstruation.
You're right.
Yeah, you are right. Okay.
It's catamenial pneumothorax, endometriosis, pneumothorax. So note down the anagram words and move on. So this is a diagnosis. The first photo. I hope the video is visible.
Next clue.
Into the next clue. Shall I go to the last clue?
Yes. We are not answering.
Okay. So the answer for this is brain-lung thyroid syndrome. The brain manifestation is choreoathetosis, hypothyroidism, neonatal respiratory distress, and NKX2 gene mutation. So note down the anagram words.
Anagram.
That is. Moving on. So the case question. So all teams be ready. 20-year-old previously healthy male presents to emergency department, 5-day history of fever, cough, increasing shortness of breath, and thoracic chest pain. He reports no history of asthma, recent infection, or significant exposures. He recently started smoking cigarettes about 2 weeks ago. In examination, the patient has a temperature of 38.5 degrees Celsius, heart rate 110, respiratory rate 26, SpO2 88% on room air. Chest X-ray reveals bilateral crackles, diffuse bilateral alveolar infiltrates as well. Lab values are given. WBC 12,000, Eostat is 8%, ABG 7.4660, ballast performed. Direct name, please do not answer now. Pound steam 60
Pound steam,
seconds.
60 seconds.
Go back now.
It's a very simple, straightforward diagnosis. 30 seconds left.
Chronic eosinophilic pneumonia.
Okay, let's go to the answer slide. It's actually acute eosinophilic pneumonia because we have given a particular history saying he recently started smoking cigarettes about 2 weeks ago. This is a very typical
of acute eosinophilic
history. Yeah. So you get minus 15 for the answer. Team B gets minus 15. So, yeah. Anagram, please. You have 15 seconds. The anagram.
Yeah, the AEP one Gunalapuriya.
What is the anagram?
ಇಲ್ಲ AEP one or anagram answer.
Last 10 seconds. So I'm closing the anagram. So team ACE gets plus 10. So at the end of this round, team A gets plus 10. Sorry, team A gets plus 30 because they've also answered the case question, right? So they'll get plus 20 for the case question as well. So they'll get plus 30, team A. Team B will get plus 5. Team B is getting plus 5. Team C is getting plus 10. And team E is getting plus 10. So I guess that ends our round. So thank you very much.
Hope you enjoy.
Scoring team, please give the marks. Scoring team. Tamil.
Hello, Tamil.
Can I take over the meeting? No, there was no anticipation, so that's right. So yeah. So first of all, I'll be announcing the final scores at the end of 3 rounds. Is that fine? Can I announce the scores and then move on?
Yeah.
Okay.
Okay. So at the end of 3 rounds, Team A has scored 247.5.
Team B has scored 65. Team C has scored 165. Team D has scored 42.5. And Team E has scored minus 30. Is that fine with everyone? Any teams have any confusions or any their own calculations? Guys, please acknowledge something. Only then I can move on or do whatever I want to.
Okay.
Yeah,
Okay.
move on. Yeah.
Okay.
Thank you. So yeah, welcome guys, welcome seniors, and first of all, thank you for your time amidst all your hectic schedules. So this is Tamil Prakash, and with me is my co-quiz master Ritika Saumi to present you the fourth round of this quiz. Just give me a few minutes, I'll be presenting the slide now. Is the slide visible? Guys, is the slide visible?
It's
Can I get
visible.
Yeah, okay, thank you. So, welcome to our round. This is Panchatandiram, which basically means 5 tricks, which is analogous to 5 lobes of the lungs, and which is the basis of our hyperlinks in the round. Okay, long story short, we'll just go on to the rules. So each team will have a set of 3 questions in the hyperlink which they choose. There'll be basically only 5 hyperlinks, one for each team based on the lobes of the lung. And first, initially, the direct team gets 2 questions for which they'll get plus 30 for the right answer and minus 30 if it's wrong, and no negatives if chosen not to answer. And each question, of course, will have a time limit of 45 seconds. And then after these 2 questions are over, then we'll move on to the lingula question, which will be open for pounds for the first 30 seconds for every team. And the pouncing teams will get plus 60 if they get the lingula question right, and minus 30 if they get it wrong. And no partial answers or marks are allowed for the lingula question. And direct team will not get any negatives for the lingula section. If they answer it right, they'll get plus 60. If not, they'll get 0. And it's their wish to either choose not to answer or something. Anyways, there's no negatives. And then regarding the pounds, there'll be only maximum 1 attempt per team. For example, if that's a direct question for team C, and if team A is pouncing at the first attempt, and further in the rounds, they won't be allowed to pounce again. And moreover, after every lobe has been done, a background image will open partially with each lobe, and for which the teams can again pounce. And for that also, the teams will have only maximum 1 attempt to pounce. Okay, is that fine? Any doubts so far? Any confusions? Okay, I hope it's clear for everyone. So again, as it says, first scoring for the background image will just progress from 100 if answered in the first clue, and then 80, 60, 40, and 20 for the last clue. Is it fine? Shall we move on to the questions?
Excuse me.
Okay,
Excuse me.
I'm sorry, I can't get you.
So what I heard was that there is a background question as well.
Yeah.
Right. So for background question also you can pounce, or for pounce there is maximum limit of 1 for me to pounce.
No. Can you please come again, sir? I can get you. I can get the last part of what you said.
What I am telling is that I can pounce only once.
Yeah, you can pounce only once, either in the first clue or the second clue. Just one time only you can pounce. So just
and in the background, the question in the background, for that I am giving the answer in pounds.
Yeah, yes, sir. For the background question, you'll be pouncing only in the groups. Yes.
So there is negative? Is there negative?
No, sir. No, there's no negative for it, but you'll be getting only 1 attempt to do it, sir.
And how many points will we get?
If you answer in the first clue, you'll get 100. If in the second clue, then 80, and then it just progresses to 20, sir.
Okay, so pouncing also gets the same point as the main team.
Can you come again? Pounds for what, sir? Pounds for the lingula question or for the background question?
The background question.
I'm just talking about only the background question, sir. For the lingula question, you have negatives.
So for background question, there is no negative, right?
For the background question, there is no negative, but there is only 1 attempt to pounce per team.
Okay. Done. Got it.
Okay, sir. So anyone else have any doubt?
Sorry, for the background question, will you give the basis on the context? will you give it? Like, what will be in the background? It could be a test, diagnosis, drug, அந்த மாதிரி
Okay,
say,
sir. அது வந்து நான் clue when the first clue is displayed அப்ப நான் சொல்றேன் sir.
Fine.
Okay, sir. Thank you. Does anyone have any other doubts? Can I move on? Okay, I'm just assuming it's an yes from everyone. So we'll move on. Okay, we'll start with which team should I start with? Okay, we'll start with team D. D for Delhi. You can choose the hyperlink. Which lobe you want to choose?
Left lower lobe.
Left lower lobe. Okay. Okay. We'll go on to the first question. This is your first question, and you'll be getting 45 seconds for it. Just the first question, you'll be getting 45 seconds. You have 20 seconds more.
What does the second question indicate?
No. The second question is yet to be displayed. That's a graph-based question. Just go for the first question.
We are not able to answer that first question.
Okay, so the time is up. You choose not to answer, or you want to attempt something.
No.
Okay, so we'll move on to the next question now. So this is a graph which is recorded during the removal of pleural fluid and the intrapleural pressure. So amongst the 4 options given, normal, trapped lung, lung entrapment, and pneumothorax, just match which color goes with which option. And your time starts now.
Can we pounce in this round?
No pounds for the first 2 direct questions. It's a direct question for the teams, the direct team. Only the lingula questions can be pounced.
Okay.
You have 10 seconds more.
Normal is red one. Then
okay, so you're giving an attempt to answer?
Yes.
Okay, just go with the answers. Can you give me the answers?
Sorry, normal is with blue one. Gray is pneumothorax.
Okay, and then the third one?
Negative, no negative.
Be quick with the answer, or else I'll have to mark negatives for it. Okay, it's getting too long. I think the answers you have given so far is wrong. So team D gets minus 30 for giving a wrong answer. And now we'll move on to the lingula question. These are the answers. And for the first one, to evaluate the risk, we'll be taking the ratio of CPAM volume and head circumference ratio, which if more than 1.6 indicates a high risk of fetal hydrops. And for the graph question, the gray one is normal, the blue one is lung entrapment, and the red one is trapped lung. Is that fine for everyone? We'll move on to the lingula question. Okay, I'm just moving on to the question. And the teams, the other teams can now pounce for the lingula question, which will be open for the first 30 seconds. Is that fine with everyone? Okay, I'm estimating it as an yes. That's it. So here we go. The time starts now. You can pounce in the groups. 5 seconds more for the pounds. Okay, the pounds closes. Only the direct team can answer now. 20 seconds more. The time is up. Do you have any answer, the direct team? You have no negatives for this, so you can just go for it. If you're getting it right, you're getting plus 60 or else nothing.
Chylothorax, left-sided, transudate, and stroke colored.
No. It's a syndrome. Okay, we'll just move on to the answers then. It's Contarini syndrome, which just basically says bilateral pleural effusions with different characteristics. One side it will be exudate and the other side it will be a transudate. So team D is getting minus 30 at the end of their part. So just give me a minute. There's a technical issue right here. I'll be back with the slideshow very soon. Sorry for the inconvenience. Okay, so that's a mistake from my side. The lobe should have been chosen by me, not the teams, because of a technical issue. And we just apologize for this. And I'm pretty sure there is nothing in the left lower lobe that you can easily diagnose with. There is just diaphragm left up there. I'm very sorry for that. Is that fine? Can we move on to the next team? And the next team will be able to open right upper lobe right now. So team E, you get right upper lobe questions. Can we move on, or anyone have any problem with that?
Excuse me.
No, I can't get you. Who spoke right now?
Where was the background?
That's actually a technical issue from my side, sir. I apologize for it. Actually, we should have gone for the lobes for the hyperlinks in a specific order, which would have given you the right clue. And opening left lower lobe would actually would not give any answers for you. It's just diaphragm left out there. I'm pretty sure about that. So I kindly apologize for the mistake from my side.
Now we are having background question or it is scraped?
No, we are not having background questions right now. And for the subsequent questions, we'll be having the background question. I'm sorry for it. Okay, can we move on?
Okay.
Okay, so thank you. So team E will be getting the right upper lobe questions now. I'm going on to it.
Team E, shall we start?
Yeah.
Is the slide visible for everyone?
The question isn't displayed yet.
No, I can't see the question.
Okay, just give me a minute. Is the screen visible now?
No, it's not. I can just see the screen with the lobes.
தமிழ் இல்லைன்னா ஸ்க்ரீன் பண்ண
just a minute, வந்துருச்சு. Yeah, 2 minutes. Just 2 minutes. Sorry for it. Yeah, okay. This is the first question for the direct team, Team E. You're getting 45 seconds for it. Okay. 15 seconds more. Okay, the time is up. Do you have any answers?
Unstable internet connections.
Okay, so we'll move on to the next question. Is that fine?
Yeah. TNM staging, tumor node metastasis.
No, we need a specific answer. So you'll be getting -30 for this question. Shall we move on to the Lingala question?
Sure, I'm not very sure how I'm supposed to pronounce it, but it's BUT. Yeah.
I'm
No,
sorry,
the time is up and we have
played.
come up with your point.
Yes, and you've already given an answer. So we'll be moving to the Lingala question. And all teams will be getting a chance to pounce for this question for the first 30 seconds.
Okay, now we'll move on to the Lingala question. Pounds is open now.
Okay.
10 seconds more for the pounds.
Okay.
Direct team, do we have an answer?
Yeah, ruptured lung.
No.
Causing pneumothorax. Is it pneumothorax?
No.
You have 5 seconds
The answer
left.
is bronchiole. No.
Okay, we'll move on to the answers then. So the answer is bronchus, which the direct team got wrong, for which they will get no negatives. But a few teams have pounced. I'll just check out the pounds and let you know which teams are getting negatives. Team A, you have edited the answer. What was the
wrote
first
question
answer
mark
you have
and
given?
I
Can
removed
know?
the question mark. I just put the question mark. I removed the question mark. That's it.
Fine. Now. So team B has given the wrong answer, for which they will get minus 60, and team E. Okay, fine. So it's only team B which is getting the negatives in this Lingala question. And we'll move on to the hyperlink where the image will, a background image will open and the teams be ready to pounce for it, which will be open for 30 seconds. Okay. Cool. The bounce is open, just 30 seconds. The bounce is closed now. Okay, we'll move on to team A, who will be answering the right middle of questions, and Ritika will be taking over with them.
Next question for team A. This is a 60-year-old man presenting with a Roman hemoptysis and painful lump on his neck. This is the imaging study, and the histopathological study is given on the next slide.
Ten seconds more
Can
for
we
the
see the
direct.
first image? First image.
Yeah, sure. Five seconds more.
The time.
The second image, please.
Okay, the time is up.
Team A, do you have an answer?
No.
Okay, so let's move to the second question. And your time starts.
Is there negative? Is there negative for this question?
Yes, you have negative for this question if you answer it wrong.
Is it CR10? CR10 scale?
Sorry.
Is it Borg? Borg scale? Borg? BORG?
Is it the same thing with the whole?
It is Borg 10. I was not clearly knowing the spelling. Borg or Brog.
The time is up.
Borg 10, it is known as something like
Fine.
that.
Okay, fine. So you'll be getting plus 30 for this question. And let's move on to the Lingula question. All other teams can count for the first 30 seconds. The time starts.
Is it a condition or is it like something else?
So any imaging nale, it's a finding or the sign or appearance of the marks.
Okay.
So the finding.
The pounds closes.
Pounds closes. Time up. Direct team, do we have an answer? You don't have negatives for this. Shall we move on to the next question?
Hello. Yes, so it is
Yes.
alpha 1 antitrypsin deficiency with pruning of vessels which can be seen.
No.
Pruning. Okay.
Shall we move on to the answer?
So this is the answer, and we'll move on to the hyperlink page.
And now we'll be having 20 seconds to count for the background image.
The pound starts now. And the pounds closes.
We'll move on with team A with the questions of the right lower lobe. Can we start? Okay, so this is the question, and we'll have 45 seconds for this.
We are not answering.
Okay, so we can move to the next question. The time starts.
Mere cotton grading.
Yes, right. We'll be given plus 30 for this question. We can move to the regular question and all teams can count now.
Hey, on the dot spotted a question coming, huh?
Yes, ma'am. Kamika. Yes, ma'am.
Then because of that. Okay, thanks, thank you.
Okay, ma'am. Thank you. Okay, so now we'll move on to the Linkla question for this low. So the pounds opens.
10 more seconds for the pounds. Pounds closes.
Invasive aspergillosis, CT halocine.
No, that is not the answer.
Now we'll move on to the answer slide. Actually,
Team A and Team
bird's
B
nest
have
sign,
pounds.
which is seen in mucormycosis. Team A and Team D have pounced and got it wrong, so they'll be getting a -60 for that. Is it fine? Can we move on to the next team, the last team? Okay, I'm just assuming it is
We'll be
yes.
displaying the background image now for the next 20 seconds, and you can count for that.
Excuse me, for the
Yes.
pounds, like there was -30, right? Not -60.
Definitely.
Okay, so for the negative points, we'll come back at the last, and I'll make sure everyone gets the right point. Okay.
Yes,
Now
we'll
the
be
pounds is
having
open for the
negative
background.
30. We'll correct with -30. It's not -60.
Closes. Team D has pounced and will come back to the right answer at the last. Okay, and Team D gets it right. They get a +60 for this. We'll move on to the last team, Team C. Sir, Polama.
Okay, now. Yeah.
Here's your first question, sir.
Hey, next போங்கடா.
Okay, ma'am. You.
Kamal.
Yeah, போயிட்டோம் ஒரே நிமிஷம் வந்துச்சு. You have 10 more seconds. Sir. Time up, sir. Do you have any answers?
ஒரே செகண்ட் பின்னால சைடு மட்டும் போறேன்.
Okay.
Okay.
Time up. So,
without point நான் சொல்லவா?
You have an answer or you're choosing not to?
லிகிதா சொல்லவா?
The time up point தர மாட்டேன் ஆனா.
ஓகே நான் பாயிண்ட் வேணாம் சும்மா அட்டெண்ட் பண்றேன்.
ஓகே பண்ணுங்க.
பல்மனரி எல்சிஹெச்
இல்ல சார் this is vanishing lung syndrome.
Okay.
Okay, so the next question, sir.
இது தமிழ் தப்பா சொன்னா you will have negative.
ஆமா சார்.
எக்கோ அடிக்குது.
Likita, I'll answer
The negative is there. Negative இருக்கு.
Cert folio da.
Okay,
Okay, sir.
Cert
Okay.
cert folio.
Get right.
Cert folio da.
Yeah, correct, sir. Correct, sir.
Correct.
Correct. So you get plus 30 for this. It's surfolio classification, and the first one was vanishing lung syndrome, sir. Everyone's fine, la? We'll move on to the lingula question now. Teams can pounce for it.
Other teams can pounce more.
Ten seconds left for the pounce. And the pounce closes.
Hello?
Now the direct team can come up with an answer.
ரெண்டுமே சொல்லுங்க ஒரே பாட்டு சொன்னா நெகட்டிவ் இருக்கா?
மேம் கோச்சிக்காதீங்க, ரெண்டுமே சொன்னாதான்.
No negative.
There's no negatives உங்களுக்கு, சும்மா கூட நீங்க attempt பண்ணலாம். ரெண்டுமே இருந்தாதான் full points மேம்.
ஒரு and half point இல்லையா?
சரி சொல்லுங்க. இது this is ventilation perfusion scan.
Okay.
ஓகேவா? and மார்க்கெட் வந்து CTEPH ல ஏதோ வரும். வேற என்ன சொல்லுவாங்க? அது ஐடியா இருக்கா? CTEPH எனக்கு either pulmonary embolism இருக்கும் இல்ல CTEPH ல நோட்ஸ்.
ஏதாச்சும் ஒரு ஃபைனல் ஆன்சர் தரீங்களா? டைம் அப் சார். டக்குன்னு ஆன்சர் ஏதாச்சும்.
ஃபைனல் ஆன்சர் will give VQ scan is the scan. மார்க்கெட் எவிடன்ஸ் வந்து pulmonary hypertension CTEPH மாதிரியா?
Okay sir, correct தான். You get plus 60. Okay, so this is a ventilation perfusion scan. The moth-eaten appearance can be seen in bronchiolated obliterans, and pulmonary hypertension is also taken as an answer. Okay, so now the final image will be displayed, the background image. Teams be ready for pouncing, which will be open for, of course, 30 seconds. And there's nothing behind that lower loop. Don't worry about it.
There is no negative marking, no, in this one?
No negative.
Okay, so the time is up for the pounce. I'll come up with the teams which have pounced so far. Team C, Team A, and D also pounced. No? Okay. So Team A and C have pounced now, and they get it right. It's Garland sign seen in sarcoidosis. We have right and left hilar lymphadenopathy and right paratracheal lymphadenopathy as well. And that marks the end of our quiz. At the end of our rounds,
At the end of this round, Team A gets plus 40, Team B minus 30, Team C plus 130, Team D plus 60, and Team E 0. Is that fine?
Excuse me.
Yeah,
You did not
Team
give
B
me
is
marks for that
no, not him.
tracheal bronchus question, that lingula sign. Bronchial Swiss.
Yes.
For that question, you did not count the marks.
Yes, sir. So you got the marks for it, and we'll come up with the final marks right now.
Okay.
But
Your team A.
minus 30 for getting wrong pounds instead of minus 60.
Yeah, that we have corrected, ma'am. We have given only minus 30 for the teams which have got wrong. And so, can you please still you belong to team B or A, just to make sure things are right?
Me?
Yeah, yes, sir. Yes, sir.
I am from team A.
Okay, sir. So you get a plus 64 for the pounds you got from Lingula.
Okay. Thank you.
Can you please tell for team B the score?
Team B have scored. You have got only minus 30 in this round. Okay. Any other doubts? We are ending the round. Any other doubts for the points or anything? Okay, it's an yes.
Can you tell the
Xavier.
final scores? Final scores if possible.
Okay, at the end of 3 rounds, you need the score, sir. At the end of 4 rounds.
Yes.
Okay, at the end of 4 rounds, Team A has scored 347.5 and Team B has scored only 35. Team C has scored 295. Team D is at 12.5 and Team E is at minus 60. Is that fine? Anyone have any doubts regarding this? Okay, we'll move on to the next round. And thank you for your patience, sir. Thank you.
Excuse me. This is from Team D.
Yes.
Can you clarify the marks? As we have got minus 30 instead of minus 60, yeah, right?
Yeah. You've got only minus 30 for the negative you've got.
And we have total score of 42.5 at the end of third round. And plus 60 for that garland sign.
Okay.
And minus 30. So it will add up almost 70, I think so.
You get plus 60 for the pounds. We have forgot to add it, and it's you are at 95 points at the end of 4 rounds. Is that fine?
Okay. Thank you.
Hi.
Excuse me.
So we have yes.
Actually, for our team as well, they did not count the sarcoidosis score. Please, can you please just once recheck?
No, sir. Come again. Come again with what you said. I can get you.
So what I'm telling is that for our team also, I think we were not rewarded with the marks for sarcoidosis, though we answered it. Please check once.
You answered it correctly, and you got 40 points for it, sir.
Okay, so for that we got plus 40. For the lingula one, we got plus 60.
Lingula one plus 60. Yes, sir. We have added it too.
And for the main question of the round, we got for that also marks.
Yeah, yes, sir. You got plus 30. You got plus 30 for the direct question. You got plus 40 for the sarcoidosis and plus 60 for the lingula, the bronchus.
So at the at the beginning of the round, we were having 247.5, and in this round, we are getting 130.
Okay.
So we should be having 377.5 and not 347.5.
No, sir. You were given a negative answer.
Okay. That solves the equation. Yes. Thank you.
Excuse me.
Yes.
So we answered one question which had the answer of cotton milk grading. So we haven't been given the marks for that, and we're just been given minus 30.
Sir, it's echoing too much. Guys, your audio isn't clear. Can you please make it clear?
Actually, we answered for the question which had cotton mayor grading as the answer, and still we have only been given minus 30. I guess the marks haven't been added.
minus 30. So you're from team E, right?
Team B.
So team B. So no, you have been given the right marks. You have got a negative of minus 30. And then you have
How
got
much
plus
marks?
60 for the sarcoidosis you diagnosed.
Yeah, but how much marks have been we given for that cotton milk grading?
You've been given 30 marks for it, sir.
So, okay.
So I'm pretty sure the points are right by now. And we'll move on to the next round. Is it fine, sir? Thank you so much, everyone.
So, good evening to everyone. We're down with we're down with 4 rounds, and we have like 2 more rounds to go. So, me and my co-quiz master Roshni will be doing the 5th round. It's 5 into 5 grid-like type round. So, I'm just going to present my screen now. Is my screen visible? Is my PPT visible?
Yeah, it's visible.
Okay. So we're going to be doing a round called Panjamirdam, which is a concoction of 5 delicious things in Tamil. We'll try to replicate that. So let's start. So this round entirely consists of 5 hyperlinks, and each team gets to pick their hyperlink according to the ascending order of marks. And each hyperlink has a mixed bag of 5 questions from various areas of respiratory medicine. And each question carries 20 marks, and the direct team gets 45 seconds to answer the question, including the time taken to read the question. And we will not be reading the questions, you yourself have to read the questions. And other teams can pounce within 30 seconds by direct messaging the quizmaster in the WhatsApp group. The time will be kept by Roshni. And the pouncing teams will be getting 10 marks for the right answer. There is half of the marks for the direct team. And no negative marking at all in this round. So, according to symptomatology, we have kept hyperlinks. So, Tamil, can you tell me the team with the least amount of marks? Tamil.
Yes. Solo?
Can you tell me the team with the least amount of marks?
Right now, the team E is with the least amount of marks.
Okay, team E.
Can you once again show the rule slide?
Okay. Any doubts?
No negatives in pounds, right?
No negatives in pound. No negatives in pounds. No negative in direct.
Okay, thank you.
Okay, that's clear.
But guys, you get to attend only once. We won't entertain more than one answer. So please make sure you're giving the right answer in the first go.
So, okay. We will be starting now. So, team E, choose your hyperlink.
The first one.
Okay, we're going with cough. Fine. So, Roshni, is the timer ready?
Yeah, the time is ready.
So, question number 1 of the hyperlink 1.
Time starts now.
The screen isn't visible. Like I can't see the full question.
Can you see it now?
No.
No.
It's actually visible. It's visible for us.
Visible for us, though.
Okay. Yeah, it's visible.
Us. And your time is
No, intern will be excited only on the first day.
okay. So the first question, time is up. Can the direct team give the answer?
Yeah, pulmonary embolism.
You are right, but that is not the complete diagnosis. So, kitna on slide?
Yeah, so the answer is Carney's complex. Team B and Team C have bounced correctly. Like Team C has given the components of it, and Team B is also bounced correctly. So both Team B and Team C get 10 points, and am I on mute? Okay. Team B and Team C get 10 points. Team A, you have given it as Carney's triad, that is not correct. And others don't get any points. So that's it. Going on to the next question. This is the second question.
Your time starts now. Seconds. And your time is up. So the direct team, please give your answer.
AERD. Aspirin exacerbated respiratory disease.
Even the triad as well.
Samto's triad.
Yes, okay.
So Team E gets points for this question. You get 20 marks for this question. And others all get 10 marks each for this question. They've all bounced correctly. So can we move on to the next question? Yeah.
The time starts now. And bounce closes now.
So, direct team, are you ready with your answer?
They have 5 more seconds.
Okay.
And your time is up.
No, I'll choose to skip.
I'm sorry, can you repeat?
I'll choose to skip.
Okay, so direct team doesn't have an answer. For all other teams have bounced correctly, and each of them gets 10 marks.
ऐसे भी हो सकता है, पता नहीं मुझे.
Okay. Can we move on to the next question? It's the answer for this question is yellow nail syndrome. So your time starts now. Direct question for Team E.
Direct team, could you please let us know the answer?
Yeah. No.
Keep the answers live.
So the answer is it's melioidosis. Team C, Team A, Team B have pounced. Team B has given the answer of Burkholderia. I can give partial marks. We can give for this. I think Roshni, is that okay? Or
Yeah, that's fine. Mention species as well. I mean,
yes.
Given only Burkholderia.
They have only given Burkholderia in the group. So we can give partial marks.
Partial marking can be given.
Okay, so Team B gets 5 marks. Other teams don't get any marks for this question.
I hope that's okay with the other teams.
Okay?
Yeah, it's okay.
Yeah.
Let's move on. So this is the last question, I think. Identify the test.
Bounce is over.
So direct team, do you have your answer?
Nasal membrane transepithelium. It's for nasal membrane transepithelium. Nasal membrane NST test.
Yeah, you will be getting 10 marks for this question. And all other teams have pounced correctly, so they will also be getting 10 marks each for this question. Okay?
Next team does order.
Okay, so let's move back. So, can you tell
Hello,
me this?
ma'am.
Yes.
Ma'am, this is Gokul. Team E got how many scores, ma'am? In this previous one.
In the previous round, Team E has only answered 2 direct questions correctly, so they've gotten 40 marks.
Okay, ma'am. Okay, ma'am. Thank you, ma'am.
Okay. So, after Team E, which team has scored the least? Like second least marks?
Team D, ma'am. Team D.
Team D. So, Team D, can you choose your hyperlink, please? Team D, can you choose your hyperlink?
Team B or Team D? Can you please
D for
clarify?
dog, right? D for dog.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Team D, can you choose your
Can you
hyperlink?
specify the marks as we have told 95 marks for last round total, and then you are telling we are at the last second.
Team D.
Team D has only 12.5. Team B has 95 points.
Asking about Team D. D for dog. Or like drum. Team D, can you choose your hyperlink?
The last one with smoking.
Okay. Just a minute. Why isn't the hyperlink working?
Shall I share it?
Yeah, can you share it?
Yeah, sure. 1 second. Okay, so which team is going to be choosing now? Direct team.
We are not seeing the presentation. Slide is not visible.
Are you able to see the presentation, Keetana?
Yes.
I am able to see it.
The last one with smoking.
Give us a second.
Let me try again. Is my window visible right now?
No.
Is my window visible right now?
No.
Your screen is still visible to others. Stop screen sharing. Okay, no one's sharing right now. Shall I share again? Okay, just a minute. Okay, is my presentation visible right now?
Yes.
Okay, so you wanted to go with smoking?
Yes.
Things aren't working.
Keetna, slide number 60.
I think it's only the fifth one which isn't working. It's only the fifth hyperlink which isn't working. Others are working. Okay, shall we start? So team D, right?
Yes.
We'll start with the first question. Timer's ready?
Ready.
Okay, let's go. So this is the first following radiological signs, and you have to answer them in a clockwise direction.
Pounds gets over now. Direct team, your time is up.
Yes. The second, the black hole wala image is aspergillosis. Then the one with left and lower is a lung abscess, air fluid level. And the last one is split pleura sign. And the first one is tree in bird appearance.
Okay, so we'll just go to the answers now. So the first one you said is what was your first answer? Can you just repeat?
Tree bird appearance.
First is tree and bird appearance. Second one, what did you say? Excuse me. Second one?
Aspergillus is hello sign.
Halo sign for second one. Left lower?
Left lower air fluid level, lung abscess.
Left lower is lung abscess.
And the one with the last is split pleura empyema.
Split pleura.
Empyema, split pleura sign.
Okay. So we'll just go to the answers now. So first one is actually air bronchogram sign. You can see the air bronchogram. So first one you've given wrong. Second one is actually coronary radiator sign, calcification in bronchogenic carcinoma. That's wrong. Split pleura sign for abscess collection is actually, you have given that as correct. But the left lower one is actually tree in bud appearance. So that is wrong. So split pleura is correct. You will be receiving 5 marks for this particular one. So team D is getting 5 marks.
Finalists, please switch on your videos.
And other teams, team A has given 2 out of 4 signs correctly, so they will be getting 5 marks. Team A will be getting 5 marks. And team B only answered 1 question correctly, so that's 2.5. Team B gets 2.5 points. Team D, you have not given any answers. So that is there. So team A gets 5 marks. Team B is 2.5. And team D is 5 marks. Okay, so this is the second question. This is A, B, and C. So you have to identify A, B, and C. This question is actually all or none. If you do not give all of them correctly, you will not be receiving any points. This is for both pouncing and direct teams. Because you have 3 things here, right? That was 4. So I don't want to split marks.
Pouncing time is up. Direct team, time is up. Please let us know your answer now.
A is for bronchus. B is brachiocephalic vein. And C is precordium for the heart.
So actually you have answered wrong. A is bronchus, left main bronchus, and B is impression for left subclavian vein. And one more thing, you can see the C, it is very clear that it is heart impression, and we have also given it as left pulmonary artery aortic impression. This is the left side of the lung. See, it has a groove for arch of aorta.
Okay, anyways, next, so they won't be getting marks for this.
No partial markings for this question. And I think only team B has pounced correctly. Team B will be getting 10 points. Yes.
If you see the anatomical position of this lung, then will not be it right-sided lung.
Yeah, it should be right-sided lung, anatomical position.
2 lobes, and I know, but if you
but
keep
this
it
is
in the
like this is not actually like a actual lung. I mean, this is a illustration from Netters, and this is clearly the left side of the lung because
I
all
thought
the
in
others
it's
have
like
been
that.
marked as aortic impression, left inferior pulmonary vein, and left inferior pulmonary artery. So this is clearly the left side of the lung.
Okay, okay. It was
I
missed.
mean, I didn't like this is directly from Netters, and to make it more apparent that it is the left lung, I have also kept the left pulmonary artery and left inferior pulmonary vein things open. So, sorry guys, no partial marks.
Okay, we'll move on to the next question.
Only team B gets 10 points for this question. So connect this.
Pound's time is up. And the direct team, your time is up.
Do you have an answer, direct team?
Direct team, do you have an answer?
Schleverbusch mask, the initial use for open method for anesthesia.
No, I'm sorry, that's not the right answer. The common link. Shall I reveal the answer now?
Yeah, you can reveal the answer. I don't
The
think.
answer is Haldane actually. Haldane is the one that's common, the black whale respirator, and then the second one is famous. Second and third images are both of his famous experiments. So on to the next question now.
Okay, I'll just switch to the next. Yeah. So these are all paraneoplastic syndromes for lung cancers. So you have to identify the paraneoplastic and the lung cancer and send it to us. Second one, ignore the DI part of it, okay? Pound starts now.
Pound's time is up. Answer.
First one is bronchogenic carcinoma, clubbing. Second one is small cell carcinoma. Third one is squamous cell carcinoma. Fourth one we have doubt. It could be large cell carcinoma.
Yeah, actually, perfect.
Adenocarcinoma.
I mean, the first one, you've given us bronchogenic carcinoma, but Roshni, should we consider it bronchogenic carcinoma and adenocarcinoma? Can be considered. Yeah. Okay, so we'll consider it. Team D is directly getting 20 marks. Team B, C, and A, actually, you've given clubbing is for small cell carcinoma, but no, clubbing on the either bronchogenic or adenocarcinoma we're accepting. So A, you have not given correctly. And A, we can give partial marks because you have answered the... No, actually, you've answered... You answered 2 out of 4 correctly. So I will give partial marks for this because 4 things, right? So A will be receiving 5 marks. B will be receiving 10 marks. C will be receiving 10 marks. D will be receiving...
Excuse me. Team A here, we have answered 3 of them correctly, except bronchogenic.
No, you meant last is squamous cell carcinoma. Squamous last is not squamous cell. Gynecomastia is the last one.
I meant when we go.
No, last we went clockwise. We went clockwise as per your instructions in the first question.
Oh, okay. Then I can consider. Okay. But okay, fine.
I have written also hypercalcemia, last one. Like
okay, 3 out
squamous.
of 4, I can give you 7.5 marks. Is that okay?
Yeah.
Thank you.
A gets 7.5. Is the score master noting is down? A gets 7.5, B gets 10, C gets 10, D gets 20, and E is not getting any.
Ma'am. Hello, ma'am.
Yes.
Ma'am, can you tell scores of the previous question, ma'am? Actually, you only told team D got 20. What about the other teams, ma'am? The pound scores.
The Haldane one, this one, the pounds? You mean
Ma'am, the previous one,
This one?
Yes, ma'am.
No one got points for this.
Okay, ma'am.
Okay, yeah, 7.5, 10, 10, 20, and E gets no points.
Okay, ma'am.
We'll move on to the next question. We have to wrap it up soon. So, this is a literal connect. So, teams can start bouncing.
Guys, we repeat, this is a literal connect. Look at the words and you'll be able to get the answer rather than looking at the images alone. Pounds, your time is up. The direct team, you have 10 more seconds. And direct team, your time is up. Please let us know your answer.
Pneumomediastinum.
I'm sorry, that's not the right answer.
Acute interstitial.
Okay, so the right answer is actually Hamann-Rich syndrome, and only team B has pounced correctly. So we are giving 10 marks to team B, and other teams get no points for this question.
Yes, with that we wrap up this set. We will move on to the next set. Can you let us know which team is going to be choosing next?
Who got the
who's third from in the same order?
Team? Gokul, you're not audible. Gokul.
I'm sorry, we can't hear you. Can you put it in the chat box?
You can also just DM me, dude. WhatsApp la.
Hello, is it audible, ma'am?
Ipo audible ra. Sorry.
Ma'am, team B, ma'am. B for ball.
B for ball. Okay. Team B, choose your hyperlink.
Hemoptysis.
Okay. So we'll go. The first question is, I'll just read this out. In 1986, while operating on a patient, I was struck by the flexibility of the rib cartilages and thought, if these cartilages are so flexible and malleable, why am I removing them? The real question was, however, what can one do differently? The next time he operated on the patient with the same defect, he made the same standard incision across the chest. He didn't remove any skin or muscles, or he did not attempt to remove any rib cartilages. Instead, he just made a small hole in between the ribs, and then a long curved clamp was then inserted into the chest, and a tunnel under the sternum was slowly created for this procedure. Next slide, I'll go. The tip of the clamp was then advanced out of the chest on the other side of the sternum. The surgical tape was attached to the clamp and pulled through the substernal tunnel. Once the bar was in position, it was turned over to 180 degrees, and then the defect was corrected completely with no rib resection, no wedge resection, and no essential blood loss. So what is the defect we are talking about here, and what is the procedure that is done to correct the defect? Teams can start bouncing. Yeah.
No negative marking na, for the direct.
No negative marking for any.
There is no negative marking.
No negative marking in the round at all.
Can you go to the previous slide?
Is the defect shown here is pectus excavatum?
Is this the direct team?
Yes, it's from team B.
Was the pounce time over? Why did you answer before the pounce time was over? I mean,
we will let you know when you can answer.
Okay.
We are counting the seconds here. Okay. So what can we do? We'll just we'll nullify the pounce, or we'll nullify the.
Well, the teams that have already answered, we told them they can answer only once. So for those teams, we won't give marks.
Okay.
Team C, A, B, and C won't be giving you marks.
Roshni, your voice is breaking a lot in that meeting.
Yeah, teams A, D, and C, they have already pounced, so they won't be seeing any marks for this.
Team E has actually pounced correctly, and they have actually pounced in time also. I just checked.
Yeah. So I guess we can give E, which is basically 10, and B will be getting 20 for this.
B will get 20 for this, and E will get 10 marks, is it? Okay, B gets 20 and E gets 10. We'll move on to the next question. Hello? We'll move on to the next question. Am I audible? We'll
Yes.
move on to the next one. Okay, we'll move on to the next one. Name the device.
Direct team, you have 10 more seconds. You can answer later. Direct team, please tell us your answer.
Is the image shown as rota inhaler?
I'm sorry, that's not the right answer.
So the any purpose of usage behind the instrument, you know why they use it? Okay, you didn't answer it. Fine. So this is an a cappella or an oscillatory PP device that provides oscillation to the airways. So for this question, C and E have bounced correctly. So each of them get 10 points. Team D has given a peak flow meter. We will not consider that question. So we will not consider their answer. So C and E gets 10 points for this question. Okay? We'll move on to the next one. This is a case
Okay, all the finalists, please switch on the videos. All the finalists.
When we have to change the slide and see.
Can I change the slide for this? Okay, I'm going to the next slide.
Pounds, you have 10 more seconds. And your time gets over now. The direct team, you can start answering if you want. And direct team, your time is up.
Pulmonary artery hypertension.
Team D, your answer is wrong. So the answer is portopulmonary hypertension. It's again a subset of pulmonary arterial hypertension, but the case that we have given here, it fits perfectly for portopulmonary hypertension. Like I've given all the values. So just a PAH we will not be taking as the answer. So you'll not be getting any marks. C and E have pounced correctly. So each of them get 10 points. And
Team E has answered?
Team E, yeah.
E.
Mama, actually it and they deleted their answer.
Yeah, I deleted it.
So I saw it and then I put the tick, but now I'm seeing you've deleted.
Yeah, I deleted it by mistake.
By mistake?
I'm sure you deleted it by mistake. I was editing it and I deleted it by mistake.
Okay, so like I saw the answer and the time got over, so I will be taking your answer. It was in the group. So portopulmonary hypertension is correct. Team C gets it, Team E gets it, and then Team D has answered Wood's criteria. Diagnosis you have not given though. Okay, I can give, I think.
Guys, we want everyone to please switch on your cameras. We know what's happening. It would be really wonderful if you cannot come.
Guys, before going to the next question, please everyone switch on your videos. All the finalists, not only the direct team, all the finalists, please switch on the videos. For every question, not just this question.
Okay, Team C, Team D, Team E each get 10. Team D is direct, right? No, Team B is direct. Team C, Team D, Team E gets 20, gets each 10 marks.
Yeah, A have given points for, okay, what was that? The hepatopulmonary syndrome.
Yeah, hepatopulmonary, no, it's portopulmonary hypertension.
Yes, so we won't be giving any points for that. Can we move on to the next question now?
Yes, we can.
Hello?
Yeah.
Is Team D getting any marks for this question?
Yes, I told Team C, D, E, 10 marks.
Okay.
Okay? Yeah.
Yes, we'll move on to the next question. Guys, please understand we do not have a lot of time. So direct teams, we request you to answer as soon as your time gets over. Next question.
Okay, this is... Can you answer this question?
Is the time over?
The time for pounds is over.
So can we say?
Yeah, you can.
Kivine-Silsback test for sarcoidosis.
Yes. Okay. So team D gets 20 marks for this. Team A, D, and C each get 10 marks for this.
Yes.
Okay.
Ma'am, can you tell again, ma'am?
Team B, I mean the direct team gets 20 marks. B for ball. Team B. Team B gets 20 marks. And team A, C, and D get 10 marks each.
Okay, ma'am. Ma'am, A, C, and D. D for dog.
Yeah, A, C, and D.
Okay, ma'am. Done.
Okay, yeah. Direct team வந்து 20 marks. A, C, and D get 10 marks. Okay?
Okay, ma'am.
Okay. So this is the next question that we have. Let's start.
Pounds, your time is up. Direct team, your time is up.
The yellow one is sevoflurane, and the pink one will be isoflurane. The blue one is desflurane, and the red one I'm not sure. I think
Red one is halothane.
Okay. Highest.
Okay, so the complete answer has only been given by team D. D for dog. So team D has given a complete answer. So they get 10 marks. That is the pounds team D, dog. Okay. And team C, no marks because you have not told the colors. So team C, no marks. Team A gets 7.5.
And highest is desflurane and lowest halothane for MAC.
Highest is for MAC, you're telling?
Yes.
No. MAC is the gas with the highest. Not out of these.
Okay. Sorry.
So can you tell
nitrous oxide.
And lowest MAC?
Lowest MAC is halothane.
No, but
no, it's not.
No, okay, you have already taken your answer. Okay. So your answer is
For team C, we can give partial marking because they've given one part of the answer right.
They only told team C.
The second part of the question is correct. The first part is not there.
First part match பண்றதுக்கு we thought we'll get 7.5 is enough rather than typing a lot.
I can give
Okay,
2.5. They have to match the colors.
Sir, I think
they haven't matched the colors. They've just named the device. Adukada.
Yes, and they've given the gas with the highest and lowest MAC.
Lowest is not sevoflurane, it's methoxyflurane.
Okay.
So I can maybe give them 2.5.
That's no, I don't think we can give partial marking for that.
Okay. So team A is getting 7.5 marks. Team A is getting 7.5 marks, and Team D is getting 10 marks, and Team B is getting complete 20.
Ma'am, can you tell again, ma'am?
Okay, da. Team A இருக்குல்ல, A is getting 7.5.
Okay, ma'am. Okay.
Okay. Team B is getting complete marks. Direct team is getting 20 marks.
Okay, ma'am.
Team C வந்து I'm not Team C மட்டும் I'll tell you again. Team D is 10 marks.
Okay, ma'am.
Team E வந்து no marks. Because they've only given device name. I want the colors. They have not given. Team C, like, I cannot give marks. Sorry, because like you answered very partial. I can give 2.5, but
No, the first thing they had to answer 4 plus 1 and the second 2 parts, so we won't be giving them any marks. We'll proceed to the next question now.
Okay. Okay, we'll go back. That's all. This is the last of the set. So, which is the second highest team?
Guys, please make it a bit faster.
Yes, the last two. Second highest team, please. Gokul. Second highest team.
Team C, it's Team C.
Team C, choose your hyperlink. Cyanosis and breathlessness are left. This one and this one. Which one you want?
Cyanosis.
Okay, we'll go with cyanosis. So connect.
And your time starts now. Pounds, your time is over.
Can we answer now?
Yes.
Yes.
Okay.
Lofgren syndrome.
Yeah.
Your answer is correct.
Is my voice echoing? Okay.
No, it's not. Teams A, B, and D, you get 10 points each for pouncing. We'll move to the next question now.
And C gets 20 marks. Okay. So next question.
Pounds, your time is up.
Okay. Kaplan syndrome is any pneumoconiosis with rheumatoid arthritis. And Legislative Act is ESIC Act and Factories Protection Act.
Yeah, we'll take it. We'll give 20 marks. Team D gets 10 marks. D for dog. Oh, I should get a better word. Team D gets marks. Team B gets marks. Team B gets 10 marks.
Team B gets 10 marks. Team D gets 10. Team E gets 5 marks because you've only given half the answer. And Team A, you get 5 marks.
Yeah, 5 partial marks.
Yes. So we'll be moving to the next question now.
What's the scores to Team C, ma'am? How much mark for Team C?
C 20 marks.
Okay. C, ma'am. C for cat. Okay. Okay.
C is the direct team, they get 20.
Okay, ma'am. Okay, ma'am.
Okay, we'll move on to the next question. We have 4 diagrams. There is partial marking for this.
Please move from the left top one in a clockwise order and give us your answers. The left top one will be the first answer. From that, please move clockwise.
For the
Bounce, time is up.
Okay, just one thing is for the right lower diagram. I mean, I think on the PPT edit pandradhula it came out. So you have to name a condition which has the type of, okay? You have to name a condition. A medical condition.
First, okay, A is Davenport diagram.
Okay.
C is Ziegler Anderson normogram. And CC. B is tracheostenosis intrathoracic and variable obstruction.
Fixed obstruction.
Fixed obstruction. And D is inspiration poche, so it's extrathoracic obstruction.
Okay, yeah. Inflation, can you name a medical condition?
Fibrosis, pneumothorax, extrathoracic obstruction. Or else any tumor is coming.
Sir, 1 second. Pounds, if any of you are going to keep editing your answers, I'm sorry, we will not be entertaining it.
See, after the direct team tells their answers, please don't edit.
It's okay. We know that spelling mistakes are possible and we accept all forms of spelling mistakes, but please don't keep editing your answers. That will not be entertained at all.
Good diagram. Okay. Team B, I can do. No. Partial marks. Okay. Fine. Okay. Third extrathoracic. Mark Matthew. Okay. So final marks is I have given partial marks for this. So team A gets 2.5. Gokul, are you noting this down?
Keep on noting.
Okay, you're noting it down. I'm also noting it down. A is 2.5. B is 10 marks. C is 20 marks. D is 5 marks. E is 2.5. Okay? Can we go? We'll go to the next question. Okay, we're going to the next question. Connect.
Pounds, your time is up.
Can we answer?
Yes, sir, you cannot.
Can we answer?
Yes, ma'am.
Yes,
Yes, that's a good syndrome.
Good syndrome. Hypogammaglobulinemia plus lipoma. Associated myasthenia gravis.
Okay. Just a second. On mute. Okay, Team C, can you tell your answer again?
Good syndrome.
Good syndrome.
Good syndrome.
Okay. Is correct. So,
one thing, can you explain all the 4 images?
Anterior mediastinal mass is a thymoma.
Okay.
Fourth one is myasthenia gravis associated.
Okay.
And third one is on the hypergammaglobulinemia graph.
Okay, sir.
And இது வந்து peripheral smear image of good syndrome. That's why lots of cells with predominance இது இருக்கு. Left shift இருக்கு.
Vietnam?
Yes.
We'll give marks.
Yeah, you have to give complete marks. They have explained everything. So,
actually, that's a pure thymoma மட்டும் தான் வரும், but okay, we'll give them marks.
We can give them, like, they've very specifically they've given an answer. So, okay. Hypogammaglobulinemia comes in good syndrome, no? Can give.
Okay, so Team A gets 10 points, Team C gets 20 points, Team D gets 10 points, and Team E has not pounced, so they will not be getting any points. Team B, ANL is not the right answer.
Okay, we can move on to the next question. We are running short of time, actually. We're already over time.
சீக்கிரம் முடிங்கடா.
Yeah. So, you want to answer these questions? Sub-questions exclusively. You've already gotten the marks. You can just answer these questions. No, these questions are not for pounds.
சொல்லிடுவோம். இது more one staging is autoimmune limbic encephalitis associated with thymoma. Staging uses Masaoka staging, and Masaoka lung involvement வந்து 2.
Okay. Yeah, we can move on to the next one. So name the device, please.
Actually, the second part of question is also there.
Lung involvement, pleural involvement.
Next question. Wait.
Next question. அப்படியே வாயாலே படிச்சு சொல்லிரு principal
yeah. So you have to name, guys, please listen. You have to name the principle used in this as well.
இது coaximeter. So coaximeter வந்து லைட் இன்ஃப்ராரெட் வச்சு எப்படி பண்றாங்கன்னு கண்டுபிடிக்க போறாங்க. ஹீமோகுளோபின் கான்சன்ட்ரேஷன், absorption of light.
Sir, pounds, sir.
You said no pounds for this question.
அப்படி இல்ல sir, it's the last question. We have to
wait for the pounds, sir. So the previous question was
the
not
sub-questions for the previous one has no pounds because like 20 marks is given for the connect. நாங்க சும்மா the educational purposes-காக அந்த sub-question வச்சிருந்தோம்.
Sorry, okay, one Vietnam. This question will not be taken into consideration.
Seri, okay.
All of you guys, please, I hope we're audible. We will ask one question and the answer to that will be considered. There is no partial marking for it. Name the wavelengths that are used in a pulse oximeter. This is not there. Name the wavelengths that are used in a normal pulse oximeter and you'll be given 30 seconds for pounds, after which the direct team can answer. Your time starts now. We repeat, we're not taking this question into consideration. The new one that we told will be taken. There is no partial marking for it. And pounds, your time gets over.
Answer பண்ணலாமா?
Yes, sir.
So there are two. One is LED light. LED light will be red color, which is 640 to 660 nanometer, and another is infrared light, which is 940 to 960 nanometers.
Okay. 20 marks, sir. Full marks. And team A gets 10 for this question. Team B gets.
Team also gets 10.
Yeah, team B also gets 10. Team D and team E don't get any points for this. Okay?
Actually, I have a question. I gave the correct answer, if I'm not mistaken.
Yeah. For D, your team from
E.
Yeah. Oh, sorry, I just opened it.
Okay.
668. Okay, I can give. E is 10 marks. A, B, E 10 marks, and C is 20 marks. D doesn't get. Okay, we'll move on to the next question.
Yeah.
So last hyperlink. So only breathlessness is left. So which question is? I mean, team B, C, D, E. It's team A, right? The last team A. Okay.
We request everyone to please switch on your cameras. It will be really wonderful if you can do that. Okay, then we'll start.
Okay, we'll start. The first question, here it goes.
There is no partial marking for this question. We need all the answers to be right. Direct team, bounce is over. Direct team can tell your answer now.
Yes, so ensure is intubate, fact extubate. Lisa is less invasive surfactant administration, and MIST is minimally invasive surfactant therapy.
Okay, you are right.
So team A gets 20 marks. Team B, C, and D get 10 marks each. And team E, 2 out of 3 they have answered. So we'll give them 6 marks. 6 marks. I mean, round 7.5 we'll give them. Team E gets 7.5. Gokul, are you noting this down?
Ma'am?
Team A 20, team B, C, D 10, and team E 7.5.
Okay, ma'am.
Okay, we'll go to the next question.
The time starts now. Pounds, your time is up.
We want specific.
Direct team, please tell us your answer.
Hello. Yeah, nitrate related Monday.
No, actually, nitrate will also present like this, but we have given specific history of plantation working. Nitrate is more industry related.
Pesticide.
Pesticides, mostly pesticides don't have nitrate. Okay, but I'm telling 1830s, it's really a. If you think plantation 1830s, do you think they had pesticides back in 1830s?
Guys, if the answer is wrong, move on to the next one.
Okay, so
Please,
the
time is
answer is byssinosis. It's actually cotton plantation hypersensitivity pneumonitis. Cotton related.
Team C and D have given the right answer. They get 10 points each. The other teams will not be getting any marks. The next question.
So we'll be moving on to the next one. So name the test.
Name the test and can you tell us, can you be a little, when it is done as well? Pounds, your time is up.
Hello.
Yes.
So this test is photoplethysmography.
I'm sorry, that's not the right answer.
Can you mute yourself, please?
Sorry, what is your question?
This is the question. Name the test. Can you mute yourself? It's echoing here.
The answer is not photoplethysmography.
So B, C, and E are pounced correctly. B, C, and E get 10 points, 10 marks.
Team
B is also given correctly, so I'm giving them 10 marks.
Team A, the answer is apnea testing for brain dead.
Ma'am, I have a doubt. If A, B, C, D, for the
Yes.
teams got question, ma'am.
All 4 teams plus 10
Okay.
except A. Direct team
Okay.
doesn't get any points. All teams, please keep your cameras on. Okay, next question, connect.
You want the procedure or the diagnosis?
We want the diagnosis. You can also tell the procedure if you want.
Pounds, your time is up. We would like to know the condition. Direct team, please let us know your answer now.
Hello. So is that CDH congenital diaphragmatic?
I'm sorry, that's not the right answer.
um, okay, team C and team E have bounced correctly, so they get 10 marks. Other teams get no marks. Team C and team E have bounced correctly, so they get 10 marks. Can we move on to the next question? Yeah. So this is the case. There is weight gain, there is increase in abdominal girth with dyspnea complaints, there is recurrent pregnancy loss and currently infertility workup. Patient has a distended abdomen with full flanks and everted umbilicus with positive shifting dullness. Paracentesis revealed atypical cells with serous sanguineous effusion. Tumor marker panel revealed an elevated CA125. This is the X-ray findings and this is the biopsy findings. Okay. So diagnosis please.
The previous slide, please.
Pound's time is over. Main team, the direct team, please tell us your answer now.
Pseudo make.
That is correct. 20 marks for team A. Team B and C have answered as pseudo. Team B has answered makes and team C pseudo makes. It's pseudo makes, so no marks. Team D, okay, pseudo makes is correct. Team D gets 10 marks and team E gets no marks. A gets 20, D, that is D for drum, gets 10 marks. Let's move on to the next question. That's all. That's the end of the round. Yes, sir.
Pseudo makes வந்து more indicative of SLE இல்ல.
Yes, sir. I have given of
but Appla can come in pseudo makes also.
Appla can come in.
For elevated
Appla is associated with SLE. One of the case is associated with SLE.
Sir, and CA125 levels are also elevated, which is highly suggestive of.
It's an ovarian malignancy, not a fibroma.
Other than ovarian fibroma, pseudo makes. Makes is ovarian fibroma.
Can you go to that question, Ketan?
Can you show the histopathological image? If there's a tumor as such, just show the histopathological image.
There is a tumor. That is a serious.
There is a tumor. That's why I didn't put pseudo.
It's CA125.
Well, then that could suggest a pseudo.
Sanguineous effusion.
Pseudo.
Pseudo makes is
Jalma syndrome.
Actual tumor. Here, if there is an actual tumor, then I would agree with the pseudo makes.
This is Jalma syndrome.
Jalma is okay, fine, but my question is why is SLE having a ovarian tumor? SLE is ovarian tumor.
No. SLE with concurrent ovarian tumor. I mean, the SLE as such doesn't have any lift.
But is it CA125 positive?
Yes, it is elevated CA125 portrait.
So the triad of pseudo makes has a component of elevated CA125.
Serious adenoma. That's why I put the image of a serious adenoma.
Sure, okay.
Okay. So pseudo means everyone agrees with it. Pseudo means Jalma syndrome. Okay, that's the end of my round. That's all. Thank you for attending. Can I know the scores of the round? Like scores at the end of this round?
Ma'am, 1 minute, ma'am. I have only the overall score. 1 minute, I will tell you.
Okay, da.
And the scores of this rounds are Team A got 137.5, Team B got 202.5, Team C got 220, Team D for dog, got 140, Team E for elephant, got 115. Is it clear, ma'am?
Okay, da.
The overall scores are Team A got 485, Team B got 211.5, Team C got 512, Team D got 152.5, Team E got 55. The overall scores.
Hello?
Can start with next round.
Excuse me, I have a question regarding round 4. As we have told that our marks are 95, Team D marks are 95, and now it is showing 12.5, and I have written my score already. As I have got plus 60 and minus 30 in that round, and already marks were present after round 3.
I'm sorry. Team B actually got 311.5, not 211.5, 311.5.
Team D, right?
Team B for ball.
I'm talking about Team D, donkey.
The last round, the total scores of Team D was 12.5.
No, it's wrong. It should be around 72.5. At that time, also I have said the same thing, and currently also saying the same thing.
Ilada, it was 72.5 for them only.
42.5 plus 60 minus 30.
Minus 30 plus 60, 72.5.
Yeah, in that round, they got minus 90 and plus 60, sir.
No, minus 30. That's minus 16 first சொன்னாங்க தப்பா. It was minus 30.
Others, we have changed the minus 16 to minus 30. They have told 3 wrong answers and 1 correct answer, sir. So the overall is minus 90 for 3 wrong answers, and they told 1 right answer. So they got plus 60, sir. The overall score 12.5. We have scored in the last round itself.
Our total negative marking is only minus 80 as of from all rounds. Starting from first to last.
Okay, so what's that about?
I am saying that marks was not actually that 12.5. That should be more. That should be either 72.5 or
in the 4th round, you had minus 90 and plus 60, which gives you.
But I have answered only 2 questions wrong in 4th round. So it should be maximally minus 30, then minus 30. It should be minus 60.
No, you answered 3 questions wrong. We are pretty sure about that.
Okay.
And it's way after 3rd round. We made it very clear during the end of 3rd round that your scores are 12.5, and I asked twice, I guess, if everyone is fine with the and I guess you can come up with the doubt then. So we kindly request you to move on to the next round. Okay, thank you.
We would like to make a small announcement. For the last question, pseudo or pseudo makes, we will be giving marks for both pseudo makes and pseudo makes. For makes, no marks will be given.
Okay. Are you guys able to hear me? Hello?
Yeah, கேக்குது.
Yeah, okay. So,
Am I audible?
yeah, audible. Shall we start the next round? Okay, so we'll be going to the rules of the round. So, this round has 5 case scenarios. Each will be followed by 3 sub-questions, and the questions are open to all the teams. So, text the answers in the pounds groups with the sub-question number, and please ensure that you're muted. And each correctly answered sub-question will grant you plus 10 mark, and there's no negative in this round. We will let you know the time for answering the questions once the case scenario is read out. Answers given after the time limit won't be considered. Only the first attempt will be considered. Do not delete the answer once it's posted, or we won't consider the answer. And we may not go back to the case scenario slide once it's set. So kindly note down the salient points. Okay. So shall we start?
Diagnosis mark or just the sub-question as marks?
One of the sub-questions could be the diagnosis.
Okay.
Any other doubts?
No, I think you can start.
You can start? Okay. So just the case one. So a 56-year-old man was referred from the clinic for assessment of recurrent bilateral spontaneous pneumothoraces of unknown cause. He had his first pneumothorax at the age of 28 and had a total of 6 pneumothoraxes distributed bilaterally over the next 28 years. Repeated surgical interventions were done, including bullectomies and pleural abrasion. Surgical pathology showed subpleural bullae without generalized emphysematous changes or infiltration of smooth muscle cells. Aside from these acute events, the patient was asymptomatic and had no other respiratory symptoms. The patient had a strong family history of spontaneous pneumothorax in adulthood. It occurred in 4 siblings and the patient's father and 2 paternal cousins. So this is the skin finding noted in the patient, and this is the CT thorax of the patient. So from this clinical presentation and the investigation findings, the physician made a diagnosis and proceeded an abdominal CT. So we'll go to the sub question. So what is the diagnosis? We'll be giving 20 seconds for this. So let me know when the time is over.
Yeah, time up.
So 1 second. Team A, C, and E have sent the they'll get points.
A, C, yeah. Okay.
Yes. Guys, don't text after the time is over. So we'll be going to the next 2 sub questions. So to rule out which specific lesion, including I want the subtype of the lesion associated with this disease, did the physician order the CT abdomen? And what is the skin manifestation that's given? What is the gene that is affected? So we'll be giving 40 seconds for this. So please answer with the sub question number.
Both the skin manifestation and the gene should be mentioned.
Yes. So is the time is over?
Yeah, time up. Yeah, time up.
So team A will be getting 15 points. They answered chromophobe RCC and fibrofolliculoma, but they answered the gene wrongly the first time. Okay. So team B won't be getting any points. And team D won't be getting any points. Team C will be getting 20 points. Team E will be getting 10 points.
Okay.
So,
So,
can you calculate the overall score?
yeah, the overall score for the case 1 is Team A 25 marks.
Yes,
Team C.
Team B no marks. Team C 30 marks. Team D no marks. Team E 20 marks.
Okay, sir.
Okay, so we'll move on to the next question.
Yeah.
Is it visible?
Yeah. 3. So 45-year-old male who works on a construction site for the past 20 years with no significant past medical history is not a smoker. Chief complaints was progressive shortness of breath and dry cough for the past 6 months, fatigue, mild chest discomfort. On physical examination, was dyspneic and bilateral fine crackles on the lung auscultation. Oxygen saturation was 90% on the room air, and chest X-ray is shown here. It shows the bilateral patchy opacities, predominantly in the mid and lower lung zones. This is the HRCT. HRCT is given here. It's bronchial thickenings. Okay, next slide. Pulmonary function test on mild respiratory lung disease with a decreased diffusion capacity of the lung for CO was noticed, and on ball milky appearance of the fluid and PAS positive material, and cytological examination shows foamy macrophages. So time starts now. 20 seconds. I don't need the pattern of the HRCT, I just need the answer of what it is. So time up. Team A has given the answer. Team C left.
I think we can give for all the teams, right, Janani?
Okay, fine. I can give.
Yeah. So all teams will be getting 10 for this. So
Okay,
we'll go to the next up. So we'll play the
10
video
for all the teams, right?
Yeah.
Okay.
So we'll
what
play
is
the
the
video.
characteristic CT appearance called? That you have to answer. The question, what it was played the question, HRCT, what is the characteristic appearance, and name 2 other conditions that have the same pattern. And we will play this video. You have to tell the procedure. I want a specific procedure. Time will start after the video is over. Okay, Vera?
Yeah, time is in.
The time starts 40 seconds. I need a specific name for the procedure.
Actually, the time is almost over. There's only 10 seconds.
40 okay. 40 seconds நான் கொடுக்குறேன்.
Also, just mention the answer at the end.
Okay, the timer is over, guys. Please do not answer after this.
Timer is over.
So let's go from Team A. So Team A will get 10 points for the second sub question. Team B, they will be getting. Team B will not be getting any points, and Team C, they'll be getting 10 points for the second sub question. Team D
will.
Team D will get 10 points for the second sub question. Team
E will be getting 10 points.
Yeah.
Second sub question. So third sub question, it is mini ball. Yeah. I don't need a ball. Bronchoscopic ball is there, mini ball is there. Here it is a mini ball.
Okay, we'll go to the next question.
The patient was intubated, so. Okay, next question.
Just mention the answers.
Okay.
So, can we tell the total marks at the end of the second case? Hello?
Yeah.
Team A will be getting 20 points in the second case, Team B 10 points, Team C 20 points, Team D 20 points, Team E 20 points.
Okay, sir.
Okay, so we'll go to the third case scenario. So, a 7-year-old boy who's a known asthmatic for the past 2 years on inhaled corticosteroids came with history of dyspnea and minimal cough for the past 2 months and bluish discoloration of lips for the past few days, aggravated especially in the evening and night after he returns home from the school. So, it was not associated with any audible sounds. No history suggestive of allergic rhinitis, congenital heart disease. He was immunized up to date. On examination, there was cyanosis and there is nasal flaring and clubbing of Pareto, and the cyanosis improved with 100% oxygen. And on auscultation, bilateral air entry was normal. However, fine crackles were heard. X-ray, you can see reticulonodular opacities in both the lung fields and the upper lobe regions. And this is the HRCT imaging, and the bronchoalveolar lavage was lymphocytic. Okay, so I only so the first sub question will be diagnosis. I only want the spectrum of where will you put this disease under. I want the spectrum of disease where will you put this under. So we'll be given 20 seconds for this.
Time start.
Can you be more specific than restrictive? So is the time over?
Yeah, time over.
So I'll be giving team E 10 points, and I won't be giving any other team any points. So we'll go to the next two sub questions. So after obtaining certain history, so since the patient had these symptoms once he returned to home after his schooling, they probed for a certain history and it was present. And after that, they gave this investigation, and the investigation came out positive, and which is shown in the image. And so, what will be the diagnosis based on this investigation? And third sub question will be, in a known case of asthma, if the radiography suggests a bronchiectasis changes along with peripheral eosinophilia and increased IgE, what would you suspect? So time will be 40 seconds for this. Is the time over?
Time up. Yeah,
Okay,
time up.
so I won't consider team E's answer. They answered after the time was up. So okay, so team A will be getting 10 points for this. Team B will be getting 20. Team C will be getting 20. Team D will be getting 10. Team E will be getting 10. So can I tell the scores at the end of this case?
Anyone answer? Just read out the answers of the questions.
So the
For the
answer
first
for
two questions, we will come at the
previous
last.
one. So the answer for the spectrum of disease where will you put under this is the interstitial lung disease with a known cause. Okay. For the second sub question, it's hypersensitive pneumonitis or bird fanciers lung or pigeon breeders lung. I'll be considering all three. And for the third sub question, it's ABPA. Okay. So at the end of the
second question, I'll read out the
second
answer.
question.
I'll read out the answers.
Actually, not necessary. Just put in group.
Okay, fine.
So for the third case question, team A will be getting 10, team B will be getting 20, team C will be getting 20, team D will be getting 10, team E will be getting 20. Is that okay?
So team E getting 20, yes, sir?
Team E is getting 20.
Is the particular question?
No. For the third case.
So can you tell again, team E?
In the question.
மட்டும்.
Sir, can you tell again, sir?
Okay, Team A will be getting 10.
Okay, sir.
Team B will be getting 20. Team C will be getting 20. Team D will be getting 10. Team E will be getting 20.
Okay, sir.
Okay. So we'll move to the next case question. Janani, can you read this?
Yeah, next go. A 60-year-old male presented with
Okay.
A 60-year-old male presented with cough with expectoration for the last 2 weeks. He gives history of death. Yeah, is it audible? Hello. கேக்குதா?
It's
Hello.
audible. Please continue. It's audible.
Hello.
It's audible.
A 60-year-old male a 60-year-old male presented with cough with expectoration for the last 2 weeks. He gives history of breathlessness since childhood for the from 15 years of age. There is a history of seasonal variation of breathlessness with symptoms on exposure to dust and was more during cold climate that often needs hospitalization. He gives history of smoking for the past 45 years with more than 10 pack years. That's a history of exertional dyspnea for the last 4 years, which makes it difficult even during the day-to-day activities. On examination, the patient was conscious, comfortable, oriented with a blood pressure of 130/90, pulse rate was 84, and the respiratory rate was 16 per minute, and saturation was 95 on the room air. On general examination, pallor was present. Respiratory examination, bilateral wheeze was heard with decreased breath sounds. Laboratory findings showed white cell count of 11,500 with absolute eosinophil count of 400. HB was 13.3 and ESR was 20. RBS was 112 and serum bilirubin, SUT, SUBT all normal. His serum electrolytes and renal function tests were within normal range. His sputum examination for acid fast bacillus and fungus were negative, and sputum for CB naught MTB was not detected. Chest X-ray is shown below. And the spirometry, the readings are FEV1 is 46%. Post bronchodilator FEV1 was 59%. You can see the increase of more than 12%. FEV1 by FEC is 56%. Post bronchodilator ratio is not changed. So what is the diagnosis? I'll give you 30 seconds. Spirometry value po. Pinal. ஒரு நிமிஷம் இரு. Yeah, it's over. Time up. Hello.
I think none of the team will be getting any points for this.
Okay.
So we'll move to the next question.
According to the GOLD guidelines, COPD is typically diagnosed on the basis of restricted airflow indication by FEV1 by FEC ratio less than 0.7. However, X represents a distinct pulmonary function state characterized by a proportional decrease in both FEV1 and FEC, maintaining the FEV1 by FEC ratio within the normal range. So the ratio isn't altered. So identify what is that. And third, we'll play the video. The time starts now. 40 seconds.
Yeah, actually, I finished playing the video like 20 seconds ago.
Okay. Like late time. So 20 seconds.
I think time is up.
Time up, yeah. Time.
Yeah.
Team C, both right, plus 20.
One second. Okay, Team C will get 20. Team D will get 10. Team E will
10.
get 20. Is that okay?
Fine.
Yeah, other teams won't be
இல்லல
getting.
and
Yeah.
answer
So
சொல்லிடுறேன்.
yeah.
Go for before slide 4. So the diagnosis is asthma COPD overlap because the spirometry was a clue here. It was partially reverse. The FEV1 was reversibility was seen more than 12% or 200 ml, more than 200 ml. It was reversible, and post bronchodilator, if the ratio wasn't reversible, it is persistent expiratory flow was limited. That is for COPD, and the asthma feature was also there. And in the history, there was exacerbations related to the cold, and the age also from even from the childhood he was having relating to the asthma. So it is overlap. And here answer for 2 is preserved ratio impacts spirometry COPD. It will lead to COPD and more exacerbations. And 3 is targeted lung denervation, in which the vagus nerve is denervated. It is
I think
done
no need
for
to explain anything.
yeah, fine.
So for the fourth case, Team C will be getting 20. Team D will be getting 10. Team E will be getting 20. Is that okay? Scoring team.
Yeah.
Hello.
Gokul.
Hello.
சொல்லுங்க சார்.
மார்க் பண்ணிக்கிட்டியா fourth question க்கு?
For the fourth question, have you noted?
Sir, can you repeat, sir? Fourth question, sir.
For the fourth case, Team A no points, Team B no points, Team C 20, Team D 10, Team E 20.
Yes, sir. Note பண்ணிட்டேன், sir. I thought.
Okay. இல்ல for the fourth case only. Okay. So we'll go to the next case. So a 24-year-old male with a known history of cystic fibrosis presents to the emergency department with acute onset of massive hemoptysis. He reports coughing up approximately 300 ml of blood over the past 24 hours. The symptoms began suddenly after a week of increased cough and worsening shortness of breath. He denies fever, chest pain, or recent trauma. His vitals are notable for blood pressure of 100/60, pulse rate 120, and respiratory rate of 24. Saturation was 8, and examination he had course fractures and heard bilaterally, and chest X-ray was supportive of cystic fibrosis. Given the concern for his ongoing hemorrhage, he was admitted to the ICU. After conservative measures, the patient was stabilized hemodynamically, but he still had continued bleeding. So he was taken up for angiography for performing a certain procedure. Okay. So what is the definitive therapy to achieve hemostasis in this case? And few hours after the hemostasis was achieved through this procedure, patient was unable to move both the lower limbs, and pinprick sensation was lost up to T5 level. What could be the cause? Name the components of bronchopulmonary sickness. We'll be giving 1 minute for this. So we do not want the diagnosis. We want what's the definitive therapy that should be done for him to achieve hemostasis.
We have given he is having massive hemoptysis. If you don't want any other thing, we have to just definitely treat therapy for that.
And please answer with sub-question number. Please answer with sub-question number.
டைம் கொஞ்சம் எக்ஸ்டெண்ட் பண்ணலாம். டைப் பண்ணுறதுக்கு லேட் ஆகுதுன்னு நினைக்கிறேன்.
Okay, we'll give extra 20 seconds.
Yes. Yeah. Extra 30 seconds கொடுத்துருக்கேன். Yeah. It's fine.
Guys, I have to go, but it was
Time up. Yeah, it's the last question. It's over.
So, okay, actually, time up, guys. Team E and Team A has answered after the time is up. I won't be considering. So, Team A will get 20 points. Team B will get 10 points. Team C will not be getting any points. Team D will be getting 10 points. Team E will be getting 10 points.
Okay, guys, I think I have to leave now. So it was really nice quiz. Bye.
Yeah, thank you. Nami answer மட்டும் சொல்லிட்டு அப்படியே.
Yeah, so for the first question, the answer is bronchial artery embolization. If that doesn't work, pneumonectomy can be done. And for the second sub question, it's due to inadvertent embolization of spinal artery, or could also be given for Adam cubics. And for the third sub question, it's bronchial artery, pulmonary artery, and segmental bronchitis. So, can I tell scores for this particular case? Hello.
Gokul.
Ma'am.
In
Can
fifth
we
question மட்டும்
tell
scores.
scores for fifth question?
Hello, ma'am.
Fifth questionக்கு scores சொல்றோம்.
Okay, ma'am.
Team A 20, Team B 10, Team C no points, Team D 10, Team E 10.
Okay, sir.
So, can you calculate the total scores for this round? That's it. So this is the spare question. That's it.
Yeah, score போற வரைக்கும் first 2 question போ. Nami?
Yeah, I'm also calculating score. 1 second.
Fine.
So shall I tell the scores at the end of this round for this round alone?
சொல்லு.
Team A 75 points. Team B 40 points. Team C 90 points. Team D 50 points. Team E 90 points. Is that okay?
Okay, sir.
Yeah, okay. So that's it.
And for second question here, we gave actually marks for both silicosis and PAP, protein alveolar proteinosis. For that one, because PAP it is found to be in association with exposure to silica also. For secondary PAP, we are considering that, but we have given marks for both. And tracy pavement pattern.
Are the total scores ready?
Yes, sir. So can we announce the final scores? So Team E is at 145 points. Team D is at, and Team B for basket is at 251.5 points. Team A is at 560 points, and Team C wins the quiz with 602 points. Congratulations, everyone.
The quiz was very nice. After a long time,
சரி நான் சொல்லி
Thank you, sir, and congrats for winning with us.
Thank you, sir. Thank you.
And congrats and for all the finalists for coming up to the finals.
We congratulate all the winners. So we'd expect to see you all even in our offline event at Genesis from October 24 to 27. We are opening our registrations today, so please do check it out on our website. We have the junior quiz scheduled for 26th and the senior quiz on 27th. We hope to see you all there. Thank you and congratulations. I think we can call it a day. Thank you for your patience.
இவ்வளோ நல்லா நெட்டு வச்சடா.
ரூம்மேட்ஸ் எல்லாத்தையும் சேர்த்து எல்லா நெட்டையும் காலி பண்ணிட்டு இருக்கேன்.
நம்பிக்கை சோறு